Good morning, everyone, and welcome to the second annual Malaysia Women and Girls Forum, MWGF 2021, brought to you by the United Nations and the United Nations Population Fund, UNFPA Malaysia. Now, my name is Zoe, and I'll be your host for today. We're so pleased they can join us online, keeping with the COVID-19 safety protocols and physical distancing. Now, ladies and gentlemen, the MWGF 2021 theme is Bodily Autonomy, ensuring rights and choices for Malaysia's women and girls. Now, 2021 has continued to be challenging as the second year running of the pandemic. Gender equality is still one of the biggest gaps besides healthcare concerns. Now, MWGF 2021 focuses on exactly what it will take to build a better immediate future for Malaysia's women and girls, and how we can help them overcome the worst impacts of the pandemic. Now, ladies and gentlemen, we have a full agenda on the cards today with an exciting lineup of keynote speakers, panelists, and moderators taking us through essential discussions and resolutions for gender equality and bodily autonomy in Malaysia in 2022. Ladies and gentlemen, it's now my pleasure to invite Ms. Karima El Khoury, United Nations Resident Coordinator for Malaysia, Singapore, and Brunei Darussalam, to deliver her welcoming address for MWGF 2021.
Yang Berhormat Tuan Khairi Jamaluddin, Minister of Health, Yang Berhormat Fuzia Saleh, Member of Parliament, Member of the Parliamentary Select Committee for Women, Children and Social Development Issues, Yang Berhormat Nurul Izzah Anwar, Member of Parliament, Ms. Asad Turkelson, United Nations Population Fund Country Representative in Malaysia and Country Director for Thailand. Esteemed speakers, colleagues, ladies and gentlemen, a very good morning to you all. On behalf of the United Nations in Malaysia, I warmly welcome you, whether physically present or connected remotely, to this second Malaysia Women and Girls Forum 2021. Let me also say a huge thank you to everyone who has worked to make this forum happen. I'm honored to be with you today, to interact with you, hear your insights, and learn from you. The subject of empowering women and girls is a cause that is very close to my heart, both as an individual and as a UN resident coordinator for Malaysia. Gender equality is both a core human right and primary driver for development performance, and absolutely central to the achievement of the SDGs in Malaysia and the world over. As many of you will know, I'm relatively new in this country, and I'm still building my knowledge on the status of women and girls in Malaysia. I acknowledge that I'm very much a guest today, but I have to take this opportunity to share some thoughts. Let me start by congratulating the team on the choice of women's bodily autonomy as the theme for this year's forum. Promoting an informed dialogue about personal autonomy and integrity is long overdue, and today is a good day to move the needle on a topic that is gaining social and political momentum. Women's autonomy and unfettered ability to exercise control over their bodies is an absolute human right. Realizing this right and protecting autonomy is not just about securing access to health. It's about breaking those barriers that undermine women's agency and capabilities. It is about questioning those norms and practices that violate women and girls' rights to privacy, dignity, and self-respect. Women's bodily autonomy is a catalyst of educational gains, of employment, and of social mobility. It is also a protection against violence, abuse, and other forms of bad treatment. Some 4 decades ago, CEDAW was ratified, almost 3 decades since the International Conference on Population and Development, ICPD, and then Beijing, and 7 years into the 2030 Agenda. There have been many achievements with regards to the advancement of women's rights in Malaysia. A review of Malaysia's progress on SDG 5 and other related goals and targets shows that there is progress on many levels. These include a set of legislative measures, institutional and policy changes, louder voices from civil society, and progress on several national and global indicators, including on poverty, education, maternal mortality, and participation. However, progress on a host of critical accelerators of gender equality and the empowerment of women and girls has been far too slow. As elsewhere, this has many causes: insufficient political will, a measure of denialism, poor financing, weak law enforcement mechanisms, but also importantly, resistance within families, communities, and society as large. Ladies and gentlemen, the COVID-19 pandemic has laid bare profound fault lines and raised fundamental questions about the status of women and girls. Crucially, we must ask, why was it so much tougher on them? Women have suffered more and still do. Their hard-won development gains were probably too fragile to withstand such a crisis. We have seen countless heroic acts performed by women, particularly as healthcare workers and caregivers. Yet, at the same time, massive job losses, wrecked livelihoods, disruptions in access to sexual and reproductive health and rights, and a rise in domestic violence, all alongside a rise in unpaid work. And we have seen a resurgence of child marriage and school dropouts, especially among girls. The impact on certain categories of women has been catastrophic. Women with disabilities, older women, widows, single women, female-headed households, and indigenous women and girls. So now is the time to act with determination and a clear sense of purpose. As the country charts its path towards recovery, several deep-seated challenges that predated COVID need to be addressed. Ladies and gentlemen, 3 points quickly. First, understanding and respecting women's bodily autonomy is a prerequisite to rebuilding and strengthening mutual respect, safety, and dignity. It improves our tolerance of individual choices and the reasons behind them, and fosters a safe and healthy environment. It is time to address structural barriers by enacting and implementing effective policies. Second, what is not defined lacks salience, it lacks visibility, and it doesn't matter. So we need to unambiguously call out the real challenges faced. We need to identify the taboos, their scale and their impact in order to break them. That is the only way to make them matter. The media has a huge eye-opening role to play. Recent shocking reports on the suffering of adolescent girls whose privacy was transgressed are one example among many. Third, what is not measured also doesn't exist. If something doesn't exist, then it cannot be tackled. Policy gaps can only be filled with the right legislation if the evidence is there. We need data, disaggregated by age and sex, but also geographic location and other key characteristics. This is an imperative globally and here in Malaysia. Measuring progress on any goal requires solid baselines and the right indicators to monitor quantitative and qualitative progress towards the set targets. Every day, I'm inspired by the billions of women who work hard to achieve a life of dignity for themselves and their families. Those who have the potential to reimagine the future, shape our recovery, and achieve more. We need to work together for and with them to educate, raise awareness, and advocate. Delivering gender equality is important for the welfare of men and boys as well. We need to engage them. If the root causes of the problem are known and clear, we need now to identify what kind of action is needed and at which level it would be most strategic in order to ensure a safe, more equitable future for millions of women and girls in Malaysia. The Women and Girls Forum is a dedicated platform through which the UN works with a broad range of stakeholders to enhance knowledge and understanding of the issues, to identify key areas for action and coalition building. With this impressive lineup of speakers here today, I look forward to hearing your perspectives and engaging today and beyond. Thank you.
Thank you, Ms. Karima El Khoury. That was a resounding reminder on the need of gender equality here in Malaysia. Now I'd like to invite Dr. Osa Tokuson, United Nations Population Fund, UNFPA Malaysia representative, to deliver her opening remarks for MWGF 2021.
YB Khairi Jamaluddin, Minister of Health, Malaysia. YB Nurul Izzah Anwar, Member of Parliament, Permatang Pauh. YB Fuzia Saleh, Member of Parliament, Kuantan, and Member of Parliamentary Select Committee for Women, Children and Social Development Issues. Ms. Karima El Khoury, United Nations Resident Coordinator for Malaysia, Singapore, and Brunei, Darussalam. Dignitaries, members of the media, to our viewers at home, ladies and gentlemen, a very good morning to all. Selamat pagi. It brings me joy to be with you today at the second ever Malaysia Women and Girls Forum on behalf of UNFPA. We are honored and in high appreciation to the Honorable Minister of Health Malaysia joining this year's forum. And I thank the UN Resident Coordinator and all colleagues in the United Nations, the government, the Malaysia Women and Girls Forum Secretariat, as well as our media partner, the Malay Mail, for the unwavering commitment that has brought us all together today. Ladies and gentlemen, Malaysia represents an inspirational dream to many countries in which I have worked. Malaysia has done tremendous advances towards the realization of gender equality and women's empowerment. Yet, as there are worldwide, gaps still persist. Action continues to be needed to reach the gender equality aspiration. 1 year ago, this forum convened for the very first time, and the theme was Malaysia's women and girls at the heart of COVID-19 recovery. The forum resulted in 10 vital recommendations or resolutions aiming to inspire action towards the need for better protective legislation, equal and just representation in media, political and economic sectors, better access to sexual and reproductive health, and the importance of enhancing comprehensive sexuality education. The global COVID pandemic has further had profound and detrimental impacts, unfortunately, particularly on women and girls worldwide, although the full consequences have not yet been seen. Sufficient indications suggest, though, that there will be need for intensified action to reach the Sustainable Development Goals. As our distinguished UN Resident Coordinator Karima eloquently reminded us earlier, realizing gender equality is important not only as a separate goal, number 5, but towards realizing all 17 critical goals. While challenging, the COVID pandemic has, however, also provided us with a new opportunity to seek novel ways to bridge the myriad of social, legislative, logistic, behavioral, and economic gaps that the pandemic has highlighted and prompted. It has taught us to be agile, to rapidly innovate, to think and act in new ways, to overcome unprecedented constraints, to rapidly take on new behaviors, to be alert and vigilant, and to remember to care deeply about one another. And it has shown that together we can do so. Ladies and gentlemen, as we reconvene today, this year's theme is Bodily Autonomy, ensuring rights and choices for Malaysia's women and girls. What does it mean? At the heart of this concept is the power and agency of individuals to make choices about our bodies without fear, violence, or coercion, or having someone else decide for them, for us. We hope that by the end of today, we will have contributed a further understanding towards what this concept means in the Malaysian context today, and for women and girls of different ages and circumstances, as our UN resident coordinator reminded. UNFPA's flagship 2021 report, The State of World Population, was entitled, My Body is My Own, and data from 57 countries in it showed that nearly half of all women worldwide report to be challenged in exercising their bodily autonomy, and this number is probably underestimated. Currently, worldwide, women and girls' decisions are often influenced by others, partners, families, societies. And in Malaysia, as well as globally, we have seen that women and girls' bodily autonomy has been further challenged as a consequence of the pandemic. We have witnessed a so-called shadow pandemic, including increases in domestic and intimate partner violence and escalating online gender-based violence and sexual harassment, especially targeting young girls, with lasting impacts including on their mental health and well-being. In addition, girls' bodily boundaries are sometimes trespassed, exposed to, for example, period spot checks in schools and other traumatizing practices, holding girls back from realizing their full opportunities. And worldwide, the consequences of the pandemic have manifested in new poor, an increasing number of child marriages, as we were reminded, especially among the more vulnerable groups, restricted education, school dropouts, changing and more challenged livelihood and social participation for especially underprivileged women and girls. Our aspiration is for a world in which women and girls are safe and can thrive everywhere, including in the virtual spaces. Dear friends, what will it then take to prevent, heal from, and eliminate violations of women and girls' bodily autonomy? To arrive at systemic economic and social equality, including non-discriminatory gender norms and institutions? At UNFPA, we have worked with the government of Malaysia to empower youth with the knowledge and language to stand and speak up for their rights, their future. This includes ensuring their access to scientifically accurate, age-appropriate, human rights-based information about sexual and reproductive health. We have supported in strengthening community support to better respond to gender-based violence, solidifying the one-stop crisis centers in collaboration with the legal providers and police, and provided communication and awareness, community outreach to lower income segments with government and many other interventions around our mandate related to providing sexual and reproductive health, as well as eliminating gender-based violence. I look forward to learn from the discussions today and understand how we can even better support the advancement of bodily autonomy as it will be understood in Malaysia. Dear friends, while this may come across as a new concept, bodily autonomy is a human right. It permeates and can be said to underpin and contribute to all sustainable development goals, underscoring the unique contribution and dignity of each and every individual to our collective future, to our world. The welfare of half of Malaysian society is, of course, not only a woman's issue, and enhancing gender equality and bodily autonomy will enhance the welfare of the whole of the society, leaving no one behind. It will be essential, as we were reminded, for men and boys to also be fully on board on this journey to expand opportunity for all. Women and girls who are able to fully exercise our bodily autonomy and full potential will better contribute to national development, including bringing the effort and energy to Malaysia's pandemic recovery in the years to come, helping to build forward better. Dear partners on this journey, I'm glad that we are here again able to connect in one space with the many actors required to revisit the needs and identify actions required to further support Malaysia's women and girls. Here today are the government, civil society and policy stakeholders, private sector, faith-based organizations and the media. All these diverse actors are needed to bring the different perspectives and identify, as well as together rapidly advance, the necessary social, economic, and political solutions required to overcome remaining identified gaps. To quote wise words, taken at the source, the greatest rivers are no more than narrow streams. I rest in high hope that today we will come together, joining streams of ideas into forthcoming shared commitments that will be impactful and actionable. We at UNFPA look forward and are determined to be a strong partner in this journey, boosting the welfare and opportunities of Malaysia's women and girls as the country progresses towards the 2030 Sustainable Development Goals. I thank you all and wish you a productive and impactful Malaysia Women and Girls Forum 2021. Thank you. Terima kasih.
Thank you much, Doctor, for that wonderful speech. Now, ladies and gentlemen, it's now my pleasure to introduce Yang Berhormat Tuan Khairi Jamaluddin, Minister of Health Malaysia, to deliver his keynote address for MWGF 2021.
Assalamualaikum warahmatullahi wabarakatuh dan salam keluarga Malaysia sehat sejahtera. Good morning everyone. It is a great pleasure and honor to be here with you at the second Malaysia Women and Girls Forum. And I would like to extend my thanks to United Nations Malaysia, United Nations Population Fund, as well as the MWGF Secretariat for developing and organizing this solution-based platform. Ladies and gentlemen, the well-being of Malaysia's women and girls is the well-being of Malaysia itself. When a country fails its women, that country fails. We cannot progress nor make advancements as a nation if we do not have the full participation and properly invest in our female population. That is a simple fact. To do that, we must remove every social, legal, economic, and healthcare impediment that hinders their development. These past 2 years have been some of the hardest times in our nation's history. The unprecedented challenges and calamities brought about by the pandemic have created cascading difficulties for everyone, maybe even more so for our women and children. Economic hardships aside, it is the stories of escalating violence against women, the shadow pandemic of domestic violence, period poverty, online harassment, mental health crises, and especially the tragic loss of lives due to suicide that stand out. The National Health and Mobility Survey of 2017 showed 1 in 5 teens in Malaysia suffer from depression. The 2019 survey showed that 424,000 children in Malaysia had mental health problems. In my capacity as Minister of Health, and also the coordinating minister for the vaccination rollout, I've had the privilege of bearing witness to incredible feats of heroism and selflessness, especially by our women and girls. From nurses, doctors, volunteers, cleaners, service providers, caregivers, civil society organizations, and civil servants. We would not have been able to gather here now today in relative safety if it was not for their dedication, tireless effort, and sacrifice. Mere words of appreciation fall short of expressing how much we owe our women and girls, and we must consistently try to ensure that we provide every available platform for all of you to thrive. For our part, when it comes to women and girls' healthcare, we have made incredible strides over the past 50 years. Our rates for maternal mortality have dropped from 56.4 per 100,000 live births in 1980 to 23.5 per 100,000 in 2018. In the same period, safe delivery by skilled birth attendants has increased from 38% to 99%. We have also successfully reduced the number of new HIV cases to 9.3 cases per 100,000 of the population in 2020, and been able to maintain the rate of HIV vertical transmission from mother to child to below 2%. During the vaccine rollout, our Ibunisasi campaign kicked off in June 2021 and catered solely to pregnant and nursing mothers, the first of its kind in the world. Yet we know there is still a lot more that we can do to help overcome the various challenges and issues facing our women and girls, especially in the face of the pandemic. Violence against women is a health issue, a violation of women's human rights, their bodily integrity, and their sexual and reproductive rights. Abused women are more likely than non-abused women to engage in high-risk behavior, such as smoking and substance use disorders. Furthermore, the chronic stress caused by violence is linked to higher rates of chronic diseases, such as heart disease and diabetes, mental health disorders, and infections for abused women. When it comes to domestic and intimate partner violence, the One Stop Crisis Centre, which is a joint stakeholdership between my ministry, the Royal Malaysian Police, KPWKM, the Welfare Department, women's NGOs, and state governments, aim to provide a consolidated point for survivors of violence to have access to protection, healthcare, and justice. Yet, based on the sheer volume of cases, calls, and reports, it is time for us to investigate how we can up the ante in terms of expanding access, efficiency, training, counseling, as well as other vital support for women. The mental health toll of the pandemic and the subsequent lockdowns, especially on women and girls, is another core area that needs to be addressed. With a soon-to-be tabled motion to decriminalize suicide, we need to swiftly create a larger and more inclusive mental health ecosystem that adheres to international best practices for safety, confidentiality, and treatment, especially for those who are survivors of trauma. It is also fundamental to invest in creating more awareness about mental health, removing societal taboos about seeking help, and ensuring that access is affordable. And to do that, we need a whole-of-society approach and cannot solely just rely on government and the public sector. On the 10th of October, in conjunction with World Mental Health Day 2021, I launched the National Strategic Plan for Mental Health 2020-2025 that, among other things, will highlight the intersectoral collaboration and crisis preparedness in addressing mental health issues, suicide, and suicidal behavior. This also encompasses surveillance for early detection of cases that will allow for early monitoring and intervention. It also consists of strategies that involve all walks of life, including children and adolescents, and covers a spectrum of settings like the home, schools, workplaces, and the community. Ladies and gentlemen, as a sovereign state, Malaysia has commitments towards upholding our people's human rights, which include the rights to equality, to dignity, autonomy, information, and bodily integrity, and respect for private life and the highest attainable standards of health, including sexual and reproductive health. Malaysia is also a signee of the International Conference of Population Development and its program of action in 1994 that ensures the rights and reproductive choices for our women and girls, followed by the Convention on the Elimination of All Forms of Discrimination Against Women, or CEDAW, in 1995, as well as ratifying our commitment to ICPD during the Nairobi Conference in 2019. These are not aspirations, they are commitments. Commitments that are rooted in the understanding that just like most countries in the world, we must do better to ensure that we can fulfill the absolute potential rights and choices of our people, no matter their age, gender, or creed. And we have set a target to achieve this by 2030 in line with the UN SDGs. The right to bodily autonomy is a promise that is legally endorsed by the laws of our land for each and every Malaysian. Yet, I will not deny that there are essential social and legal gaps that need to be filled when it comes to our women and girls. And these gaps can and will be filled when all of us as a society decide to do better. As a policymaker, I will do more to create policies that will ensure not only the protection of women and girls, but that focuses on their well-being in all aspects. I would like to congratulate the United Nations Population Fund Malaysia, and the MWGF Secretariat for your time and effort in developing this very critical solution-centric platform that works in tandem with our policy of elevating the safety and well-being of our women and girls. I wish all of you here today a fruitful and impactful day of presentations, and I look forward to the resolutions and recommendations that will follow. With that, I, ngalafaz Bismillahirrahmanirrahim, proudly declare the second Malaysia Women and Girls Forum open. Thank you. Terima kasih.
Itulah dia juara dunia kita di KTV dari Malaysia.
This pandemic is the biggest setback in gender equality for this generation.
We have never been confronted with issues more daunting than we are right now.
This is especially true for the ones who are already marginalized by pre-existing barriers like social class, poverty, and disability.
Your thoughts and perspectives on this.
I don't think there's ever been a time in our history where the future is so uncertain.
Implementation, programs, policies.
Ensuring that there are dedicated shelters.
Women and girls.
Bodily autonomy means that one must have the power and the agency to make choices on their own bodies and on their future.
Now, ladies and gentlemen, before we proceed with MWGF's program, allow me to elaborate on the overall format, concept, and mechanisms of MWGF. Now, MWGF is an annual event that brings together multiple stakeholders and aims to be the bridge that connects the public, civil society, and policy stakeholders in rapidly advancing the necessary social, economic, and political solutions needed for Malaysia's women and girls. Now, this forum identifies, engages, and tracks key social, economic, and legislative and changes that are needed to accelerate the rights and well-being of Malaysia's women and girls. Now, MWGF is open to the public with panelists and speakers from the civil service, non-governmental, academic, legislative, youth, public, and private sectors. Funded and supported by the United Nations and UNFPA Malaysia, MWGF collectively amplifies, tracks, and provides proactive recommendations and solutions on the progress of advancing the rights and well-being of Malaysia's women and girls. Ladies and gentlemen, in the spirit of active public participation, all our keynote sessions and plenary discussions welcome questions and feedback from our live audience throughout the day. Now, our hashtags are MWGF, hashtag MWGF 2021, hashtag Badanku Milikku, and hashtag My Body is My Own. Now, do follow them and post your thoughts and screenshots using the hashtag and tagging United Nations Malaysia and UNFPA Malaysia on your social media. On that note, let's move into the first plenary session of MWGF 2021. Now, ladies and gentlemen, the first plenary session is entitled Bodily Autonomy as a Pillar of Human Rights, Understanding the Challenges of Achieving and Embedding Bodily Autonomy in Malaysia as an Accelerator towards Achieving Gender Equality. Ladies and gentlemen, our moderator for today is Ms. Tamina Kauji, the MWGF Head of Secretariat, Independent Broadcast Journalist, and gender activists. Ladies and gentlemen, I will hand over the session to our moderator, Ms. Tamina.
A very good morning, everyone. Thank you for that introduction, Zoe. It is my pleasure to moderate the very first plenary session for the second Malaysia Women and Girls Forum 2021. Now, our esteemed speakers who will be joining us, of course, in person, together with me here today and also online, allow me to kindly introduce them first. Our speakers are Yang Berhormat Puan Fuzia Saleh, Member of Parliament for Kuantan. She is also member of the Parliamentary Select Committee, PSC, on Women, Children and Social Development Issues. We also have with us Yang Berusaha, Dr. Sanuta Pupale Ratinan. She is the Deputy Undersecretary with the Policy and Strategic Planning Division of the Women, Family and Community Development Ministry, or KPWKM, Malaysia. We also have with us Dr. Narima Awin, who retired as Director of Family Health Development, Ministry of Health, MOH Malaysia, in January 2007 after serving the government of Malaysia for almost 30 years. She is also the former Regional Advisor for Maternal and Reproductive Health with the World Health Organization, or the WHO. Some of her major work at the national level includes expanding the Maternal and Child Health, MCH program, to the broader Family Health Development Program to include newer areas of concern, including women's health and gender issues. We also have joining us virtually Ong Bee Leng. Ong Bee Leng is the Chief Executive Officer of Penang Women's Development Corporation, which strives to mainstream gender into key policies, programs, and practices of the public sector, as well as creating platforms for women's empowerment with the aim to narrow gender gaps. And last but certainly not least, we have also joining us virtually from Washington, D.C., Zarizana Abdul Aziz. Zarizana is currently director of the Due Diligence Project and also adjunct professor at George Washington University in Washington, D.C. She specializes in legal and policy reform on gender equality, family law, and gender-based violence, focusing on intersections between international human rights, gender, culture, and national legal regimes. She has undertaken 45-country multi-year research on GBV and, based on the findings, developed the due diligence framework on state accountability for eliminating violence against women. Most recently, she co-authored a research paper on COVID-19 and violence against women, unprecedented impacts and suggestions for mitigation, published by Routledge in June 2021. Panelists, without further ado, let us begin. I'd now like to invite each one of our speakers to share a preliminary statement, beginning with Ms. Zarizana, perhaps, to set the tone for the entire conversation. Ms. Zarizana, is Malaysia committed under international treaties to ensuring women and girls' bodily autonomy?
Thank you, Tamina. And good morning. Good morning, fellow panelists. And thank you for inviting me this morning. Talking about bodily autonomy. Bodily autonomy affects a lot of our rights, from the right to life, to the right to liberty, to the right to security. Ironically, bodily autonomy was not one of these first rights that was granted to women. Under the Malaysian Married Women Act, for example, the first right that was granted to married women was property rights, but not the right of her personal security and integrity. And this is quite surprising to us today because, this is the way the law has evolved. Now, we have to remember that Malaysia is committed to take all reasonable action to eliminate gender-based violence. Yeah? And Malaysia has ratified the Convention on Elimination of All Forms of Discrimination Against Women. The committee, CEDAW for short, the CEDAW committee has said that violence against women is a form of gender discrimination. That's because violence against women is violence that's committed against women because the person is a woman or which disproportionately affects women. Now, what happens when a country ratifies an international treaty? Now, take, for example, Malaysia ratified the Chemical Weapons Convention. It ratified the convention in the year 2000. I'll get to the point. It seems a bit off now, off tangent. And the convention entered into force. And 5 years later, Malaysia passed a law called the Weapons Convention Act. And this was gazetted and implemented. Now, Malaysia ratified CEDAW in 1995. Yeah. And unlike the Chemical Weapons Convention, no legislation has been passed to bring the convention into law. And this was 27 years ago. Yes. And for a country like Malaysia, which is a common law country, ratifying the convention alone is not sufficient to bring the whole convention to be applied as law, because that is ratified by the executive arm, and to make law is the legislature. We have been discussing about bringing it into law. Experiences from other countries have shown that we need to create a law, but 27 years later, we're still waiting for that law. So in short, Tamina, yes, Malaysia has an international obligation. Malaysia has an international commitment to ensuring women's bodily autonomy and integrity. But we still fall a bit short in terms of we haven't passed a gender equality law. And the courts, the women have brought their cases to court on the basis of CEDAW and on the basis that the Constitution provides or prohibits gender discrimination. Unfortunately, there have been, the cases from court has been, some are partially successful, some are not. But to secure all our rights, we do need a law. Thank you.
Thank you. Thank you so much for that, Zarizana. I think that was an excellent and very concise way in which to frame the entire topic of bodily autonomy at a national level. I'd now like to ask YB Fuzia. YB, what are the main concerns impacting women and girls' bodily autonomy as observed by the PSC on women, children, and social development issues during the just concluded session of Parliament?
Thank you very much, Dahmina. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good morning, my fellow panelists and ladies and gentlemen out there who's listening. It has been a long session, a longer session for the year, and the Select Committee met every week without fail, and we have scrutinized and examined a few issues. Amongst the issues that we examined are, of course, violence against women during the pandemic. We examined the welfare of child witness and the procedures regards to child witness in court. We also examined about children in detention. We asked the Women Ministry to come and present to us with regards to the sexual harassment bill that was supposed to be, that was tabled for the first reading on 2 days ago. And we also examine, scrutinize the issue about gender equality and how we can progress better in reducing the gender gap. We identified gender responsive budget as one of a very important tool to be implemented in our country to ensure that gender equality is achieved. So those are the issues that we examined during our meetings of the Select Committee. Thank you.
Thank you very much for that, YB Fuzia. Very concise once again, and also we will be going deeper and delving into all of these issues throughout the rest of MWGF 2021 sessions throughout the day. I'd now like to move to Dr. Sanuta. Dr. Sanuta, could you please share with us a little bit more about your role with KPWKM and also related to bodily autonomy issues and how they have been impacting our women and girls in 2021?
Okay, thank you for inviting me as a panelist to this plenary session and for giving me an opportunity to talk about the role of my division in relation to bodily autonomy issues. Just like Ms. Karima, I am relatively new in this division, hence I have a script to ensure that I don't miss out whichever important points. Yeah. So our team focuses on policy directions that is related to women and family. And as you may have already known, Malaysia acceded to CEDAW way back in 1995, whereby reporting obligations falls under the purview of Ministry of Women, Family and Community Development. So my team is responsible for coordinating our country report while ensuring domestication of CEDAW and fulfillment of our obligations. In relation to bodily autonomy, the current pandemic has shown an increase on issues reported to have been impacting women and girls, such as domestic violence and unwanted pregnancy, among others. So violence against women is a serious social issue and violation of human rights. As the issue is cross-cutting in nature, Ministry have set up the Committee on Domestic Violence, or in Malay, JKRT. So my team is the secretariat for the committee, which consists of permanent members from relevant ministries, agencies, as well as NGOs, such as WAO, NCWO, AWAM, and WCC. The committee discusses on various measures that we can take to address domestic violence in Malaysia. As the saying goes, alone we can do so little, together we can do so much. So with that hope, we hope that we can end pervasive gender-based violence. So with regards to legal framework, I am sure that you are aware that amendments has been made to the existing Penal Code 574 on marital rape and the Domestic Violence Act 2017 for intimate partner violence to protect victims of violence. So we are also finalizing the guidelines for handling domestic violence cases, which is expected to be published next year. So besides that, my team also works closely with MAPO KDN, Department of Women Development and Welfare Department in collaborative efforts to facilitate and take care of victims of trafficking. So they are not detained in detention centers, instead protected and placed in shelter homes for protection and rehabilitation services under the ATIPSOM 2007. Apart from this, we assist the National Population and Family Development Board, or LPPKN, in tackling issues concerning bodily autonomy, such as sexual and reproductive health, which includes family planning, providing choices in reproduction, contraceptive methods, as well as sexual and reproductive health education. So I would like to highlight here that to enhance sexual and reproductive health services during COVID-19, we have partnered with UNFPA to provide online family planning advice, contraceptive delivery services, and online reproductive education to teens. So thank you so much, UNFPA. And I think for now, that's it. So maybe we can talk more later.
Thank you so much for that, Dr. Sanuta. I think that was a very comprehensive overview, and it is good and resounding to know that the government of the day also has so much cognition around the issues which are deeply impacting our women and girls. From there, I'd like to proceed to asking Dr. Narima, what are the main barriers, Dr. Narima, for Malaysia's women and girls SRHR access when it comes to the pandemic and, of course, the associated movement restriction orders?
Thank you, Jamina. I will analyze your question. Thank you, Jamina. I will look at this question from 4 aspects. The first one you have touched on, the very basic prerequisite of service utilization. Women and girls can only utilize the services if they have access. So Malaysia, that is the first thing I like to highlight, the access is the most important thing. In fact, our tagline for SDG is universal access to get universal coverage. The second thing is Malaysia, we can take pride in Malaysia for being one country that has made physical access really something so tangible. Today, we can shout and claim that 98% of Malaysians live within 5 kilometers of a static health facility. And with that, Yang Berhormat, I'd like to salute our first 3 prime ministers. The political commitment in Malaysia was not mere empty words. They were translated into real things. We built hospitals, we built clinics, we have flying doctor service, we had mobile clinics. So the political commitment has been very, very strong. That's the second thing. Now the third thing is, whilst in normal times, access is good, Malaysia can be very proud. Once we get an abnormal time, like the COVID pandemic, how do things look then? We conducted a study, UNFPA Malaysia and UNICEF Malaysia last year, to see the impact of the COVID-19 and associated MCO on SRHR. The findings are very rich, but I don't have time to deal with those findings right now. But suffice to say that as far as basic services like maternal health, antenatal care, child delivery, not affected, because the government made a very, very smart policy. There is limited movement, there is MCO. However, hospitals will not close. And our nurses actually go to the patient's home. LPPKN, I was still chairman of LPPKN then. One night I called the DG. What about your services? He said, Dato', you don't worry. Our nurses are going to the patient's homes to bring the oral contraceptives. So that was not compromised. However, Jamina, if you look at things like bodily integrity, I think we did not cover that part very well. I think if we do a study on bodily integrity, we might get less encouraging findings. For example, we saw the period poverty. Girls, because of the MCO, because families' economics has been compromised, girls could not afford to buy sanitary pads, for example, and we saw the period checking and all that. So that's a whole thing. And finally, the last aspect I'd like to cover in this question, Tamina, is please bear in mind that an overwhelming majority of frontline workers are women. Therefore, the impact of COVID-19 on access to general population in general and its impact on healthcare providers is very, very much related to women's and girls' rights, because women are the majority healthcare providers and frontline workers.
Thank you so much for that, Dr. Narima. Not just taking us back in history to see what the commitments have been, but also very importantly, highlighting the incredible and undeniable impact globally and even in Malaysia on female HCWs, healthcare workers during COVID. From there, I'd like to proceed to asking Bileng for her preliminary statement. Bileng, could you please share with us a little bit more about PWDC's core areas of work and how they actually directly connect to ensuring women and girls' bodily autonomy during 2021?
Thank you, Tamina, and good morning to my esteemed panelists as well as the people out there. Good morning, ladies and gentlemen. Probably I just do a quick bit about PWDC, that's Penang Women's Development Corporation. So we are actually a state government linked company, and because we are at that stage, it actually provides PWDC the opportunity to work very closely with the state, especially in regards to policy matters. One key policy that the state has adopted is the gender inclusiveness policy, probably the only one in Malaysia. This is to ensure that gender perspective is taken into consideration in the planning and as well as the implementation of the state initiatives, programs, and budgeting. To us, this is all part of good governance. Yeah, it is nothing which is alien. But putting a policy in place is only part of the equation. The next is the implementation, the monitoring, and evaluation. Now, this is where PwC plays the role. Since its adoption back in 2019, that was 2 years ago, we have taken a bottoms-up approach and worked with all the state agencies, there are 37 of them, including the local government, in how they formulate action plans. Because putting a policy in place is one. But again, the part about how do we implement it, how do we monitor it? So all these are most crucial, because we want to make sure that a policy is not put in place just as a paper. So we are very fortunate that in Penang, the state agencies and the local governments are actually very supportive of this. And this is where we have this gender responsive and participatory budgeting, the GRPB. Taking off from there, PwC has also done a lot of knowledge sharing with KPKT. This is the Kementerian Perumahan dan Kerajaan Tempatan, as well as with the Gender Budget Group. Because what we want to also see is that budget is responsive and meets the needs of the different groups of the society, as well as to look into the intersectionality of women. So we are not homogeneous. Women itself and the girls have different needs because they come from different demographics. Besides that, PwC also design and deliver programs to narrow the gender gaps, especially in the area of political representation and economic participation. In enabling the women to generate their own income, we have programs such as Wanita Jana Rezeki, especially when we saw with the pandemic, with women as well as men losing their jobs. So we were looking into how can we enable more women to be able to generate their own income, especially in the B40 group, which is probably most vulnerable. To us, financial independence is important for women and girls. We also see that actually it has a big connection, when you talk about violence. enabling women to be able to have their own income is actually a way of empowerment. And that's why we believe that this program actually will help when we talk about bodily autonomy. For political representation, we do conduct a leadership program for women in the community. And one of our flagship is actually what we call Sidang Wanita, Women's Assembly, where through a selection process, we have 40 women representing the 40 state constituencies in Penang. And we do a simulation of a one-day state assembly, whereby we bring forward issues and propose solutions to overcome some of these challenges. The issues include those at the constituency that they represent, as well as statewide issues, including domestic violence, sexual harassment, and period poverty, and so on and so forth. We hope that this program will create platforms for women to step forward and know that politics is not something alien, it's not something dirty. Because we tend to hear that, oh, politics is not something that they want to go in, especially for women, because they deem it as dirty. So what we say is that it is because it is dirty that we need more women to come in. Yeah. So, but through this process, we also want the women to realize that it is through politics that laws and policies are made, and that's where changes happen. Back to you, Tamina. Sorry.
Thank you. Thank you so much for that, Biling. It is very important that you emphasize the intersectionality of the approach, particularly looking at the melting pot of cultures, social classes, races, gender identities that Malaysia is, as well as the rallying call for increased women's participation in politics and policy making. Right. Thank you so much, panelists, so far for your preliminary statements. We now move into the discussion proper. I would like to begin by asking YB Fuzia, digging deeper into what you had mentioned just previously about gender-responsive budgeting, YB, how is bodily autonomy central to also GRB, and do you feel it has been adequately addressed in Budget 2022?
Okay, let's look at this at Budget 2022. At a glance, we can say that bodily autonomy has been addressed to a certain extent. For example, the Minister of Finance have listened to our suggestions on the additional post for the 11 offices, 100 new posts for the 11 offices. That was a suggestion from the Women Budget Group as well as from the CSOs. And also 30 million for daycare centres. I think it was in response to a certain extent to the needs for women who choose to go to work, and for women who are victims of domestic violence. There are budget to address those needs. However, I would say that I would not define it as a gender-responsive budget yet. Why? Because, as I said earlier, gender-responsive budgeting is a very important tool to ensure that gender equality is achieved. So, gender equality can be achieved if we follow the path or follow the roadmap where we legislate laws, we introduce policies, and in order to do that, we need to have very clear findings, evidence-based planning for the budget. This has not been happening in Malaysia. Malaysia has always followed the outcome-based budgeting, and usually it's always what the various ministries want or request for. A pre-budget analysis, which is a very important tool in the gender-responsive budget, has not been carried out. So that's why I would say that it's not a proper gender-responsive budget process. However, the good news is that after more than 15 years since gender-responsive budget was introduced in Malaysia, that was in 2005 when we introduced the gender-responsive budget manual. Since then, and for the first time, it has been recognized that we have issues with our data management. As mentioned by Ms. Karima just now about data, we not only need segregated data by age, sex. It's important, I have to say this, that our data is all over the place. I give an example. For example, I was trying to gather all information about female-headed households. How do we assist them during the pandemic? Female-headed households in my constituency. There is no one-stop center where I can get this data. I mean, I have to go to the ICU, E-Kasih, I have to go to Pusat Zakat, I have to go to schools and ask for that data. I have to go to KRT. Basically, I've got to go to 5 separate places to actually collate those data. So, this is a very important point to emphasize on. Until and unless we manage our data in a better way, it is impossible for us to do a pre-budget analysis. And if we don't do a pre-budget analysis, we will never be able to be on track towards formulating the right policies and legislating the laws. I mean, we are missing, we don't have gender equality law in place. But even if we have the gender equality law in place, Tamina, right now, we will not be able to implement the gender responsive budget. So listening to our views, I'm thankful to say that the Minister of Finance have listened and have actually allocated 15 million in the next year's budget towards data management, to collate existing data and to collect data in a better way to ensure that we have disaggregated data, and also finally to make sure that our planning is evidence-based. So way forward, I hope that our global gender gap index will not continue to widen, will narrow, and hopefully we are on the right track to gender equality.
That's right. Thank you so much for sharing those insights, YB Fuzia, particularly important because globally we have been set back by at least 39 years, according to the latest statistics with regards to gender equality, precisely due to the pandemic. I now move on to asking Dr. Sanuta, what has been the progress on some key legislation, Dr. Sanuta, which ensures women and girls' bodily autonomy, especially what has been discussed in Parliament of late, such as perhaps the anti-stalking bill, anti-sexual harassment bill? I'll leave it to you.
Okay. The government realizes that solid legal frameworks and policies are crucial in facilitating the advancement and empowerment of women and girls. Firstly, to increase the knowledge on sexual reproductive health among Malaysians from all walks of life, regardless of age, the National Reproductive and Social Health Education Policy was mooted. The strategies for action plan, just like what Ms. Ong was saying, so for National Reproductive and Social Health Education, or PEKERTI, have been formulated based on 4 main aspects, namely advocacy, human capital development, research and development, as well as monitoring and evaluation. Besides that, under LPPKN, there's a dedicated website, ACE, which was produced to provide accurate, comprehensive, and effective materials to learn and teach sex education. Okay, secondly, I am happy to finally say that the Anti-Sexual Harassment Bill 2021 was finally tabled for the first reading in Dewan Rakyat on the 15th of December after years of negotiation and hard work of many. After series of, after series of public surveys and consultations with relevant stakeholders, including NGOs, members of parliament, and local councillors to ensure inclusive participation, a policy decision was made to form a special project team on sexual harassment with a view to improve legislation on sexual harassment in Malaysia. The team comprised of experts from government agencies, academia, and non-governmental organizations, as well as individual experts to help formulate the bill. So the bill provides the tribunal, known as the Anti-Sexual Harassment Tribunal, the jurisdiction to hear and determine the sexual harassment complaints made by any individual, regardless of nationality, age, or gender, and regardless of whether the offense occurred at workplace or anywhere else, anywhere public, while compensation for the victims would be through suitable remedies. So this bill, very much a survivor-centric, is an important manifestation of sexual harassment as a human rights violation and gender-based violence. I'd like to highlight here that the preparation for RUU AGS was an inherently complex and complicated process subject to external pressures and unforeseeable events. So I would like to take this opportunity to thank everyone, each and everyone involved in making this possible. So moving forward, we hope, the ministry, we hope that we can work together in the efforts for a successful implementation of the Act upon its approval in Parliament next year. Thank you.
Thank you very much for sharing that, Dr. Sanuta. From there, we moved a little bit deeper into asking Dr. Narima. Now, access to SRHR, as you mentioned, is just as important as awareness when it comes to bodily autonomy. How does this also impact it across Malaysia depending on location, Dr. Narima? Urban versus rural and geography as well. Interior regions of Malaysia, of which there are many, particularly in Sabah and Sarawak, versus, of course, urban Malaysia.
Tamina, that question has two very important concepts there. Number one is awareness, and number two, you touched on the location or geographical aspect. Earlier on, I mentioned about Malaysia being very successful in achieving access. So very good access. Now, when you talk about access, that means the person must be coming to utilize your services. We look at it from the three delays. The first delay is that person must be aware. That woman or that girl must know that she has somewhere to go. If she is being violated again, that she knows where to go. So the awareness of help seeking must be there. That's only the first one. If she doesn't go, that's the first delay. The second thing is, she knows she needs to go. She wants to use the service. But is she able to? She may not be able to, simply because it's too far away. So you mentioned about Sabah and Sarawak. They have to take maybe 40 kilometers. They have to pay maybe 100 ringgit to get to pay for the taxi fare. So that physical and financial access, again, I like to repeat, in Malaysia, except for very interior places in East Malaysia, our access is good. Like I said earlier on, 98, 99% of Malaysians live within 5 kilometers of a health facility. That's the second delay. The person doesn't have the lack of awareness, but may not be able to go. Then the motivation comes in. Okay, the woman or the girl knows that she needs help. She knows where to go. She has the money. She doesn't need help to go. I mean, she's capable. She goes to the health facility or to whoever the service provider and said, never again shall I come here. I don't like this service. So she's not motivated. Why? I had to wait 3 hours to see the doctor. And the doctor saw me only for 3 minutes. So the responsiveness of the service provision is the third delay. And I think Malaysia has a lot to do on that score. Delay 1, delay 2, we are doing very fine, except for areas in Sabah and Sarawak. So Tamina, to go back to Sabah and Sarawak, yes, there are interior places. I remember I went to Kapit, I went to, it takes hours, days to reach Kapit. I thought of putting a proposal to build a clinic where the Penans lived. I decided against it because there are very few Penans living there. The cost of carrying my building materials to build that will be enormous. That was just not cost effective. So what we in Malaysia we do is we give mobile services, and in Sabah and Sarawak, the mobile service is in the form of the flying doctor service. We spent a lot of my budget when I was director goes into renting the helicopters for the nurses and the medical assistants and the doctors to go to those villages, either once a month or once in 2 weeks or once a week. So yes, Tamina, to summarize what you had asked and what I have answered you, awareness is the first step, but awareness alone is not enough. Then the person must be able to use the service. And number 3, the person must be motivated to use the service. And when you bring that to COVID-19 pandemic, much of that can be compromised. There's less income in the family. So it is, first of all, there is limited movement. So they were not able to go because of the limited movement. And don't forget, people were scared. They didn't want to get infected. So access, also the awareness was there. The use of services, the access and the coverage could have been compromised because women and girls were too afraid to leave their house and perhaps get the virus. Yeah.
Thank you. Thank you so much for that, Dr. Narima, especially your insights about travel as well as access in rural areas, particularly Sabah and Sarawak, contextualizing it against, of course, the pandemic. Now, I'd like to move on to asking Ms. Bileng. Now, on a Penang state level, what efforts have been undertaken, Bileng, to safeguard bodily autonomy? Tell us a little bit about, of course, the bright orange tower in your background.
Yeah, thanks, Tamina. Well, Penang has been organizing what we call the Penang Goes Orange. Well, this is held in conjunction with International Orange Day. Yeah, and this year is actually our 8th year that we are running this state level. It's a state level campaign. So we involve partners, the state agencies, the local government. We also have the Jawatan Kuasa Pembangunan Wanita and Keluarga. These are actually committees at the state constituencies. We also work with NGOs as well as the education institution, the universities and colleges, because we also want to get the youth, in this conversation. So the whole idea is to bring the awareness about the need to stop violence against women and girls. Yeah, and if you read a bit more, we know that this is actually part of the 16 days activism. Yeah, in stopping violence. So in Penang this year, we were focusing on ending domestic violence, especially in view of the pandemic. And data have shown us that the number of cases of DV has really escalated and all that. So we wanted to bring this awareness about stopping and what do we do, if we are one of the neighbor, a family member, or even a bystander. Yeah. So this conversation is there for people to realize that domestic violence is not a family issue. It's not a domestic issue, even though we call it as domestic violence. It actually involves public health. If a woman gets into in cases of domestic violence, you just imagine that even the public, even the health system needs to be in place, to support them. And if they are being physically or even emotionally have been going through all this, you find that we have to have a system to support them. So in Penang, what we also say, because we work with the JPWK, we actually give them the understanding that if we do see, and we also encourage our public, if you do see any cases of domestic violence, just don't walk past. Yeah, we create awareness that you can do something. Well, don't approach the family on your own. Bring somebody along. So in JPWK, we say bring 15 of your women to this home and find out what is really happening. And on top of that, Penang actually have started what we call the first support point. Yeah. So this is actually a part of the safe family policy we have adopted since last year. In it, we say that each of us, or we have trained people at the service centers of all the aduns. We also have built capacity even for the NGOs, as well as some religious organization for them to be able to take cases, become the first support point. They don't have to do the counseling and all that, but at the very least, be the support for the victims. So we anticipate that one day, in probably a 2-kilometer radius, there must be a support point for victims, because we understand there are not many NGOs are able to support, and it's not easy for a victim to go to a police station or even to the hospital to get help. So we envisage that, in the near future, we will have every radius of 2 kilometers, a victim can just walk into a place where they can get help and get support. Okay, and and on top of it, we say that if possible, one day, the community, each and every one of us, become the first support point for victims of domestic violence. This is actually our vision when we do even Penang Goes Orange this year. And you see, if you come to Penang, you see the Komta Tower is lit up like what you see at my backdrop, the virtual backdrop. Okay, so we want to remind everyone, be it the victim or even the abuser, that this message about stopping violence is not just in a family, but it's a whole society approach, that this is not something that we condone to. Yeah. So thank you for that.
Thank you, Bileng. Really important to, of course, make the rallying call, which is if you see something, say something, into something real and actionable. We now move into my asking Ms. Zarizana. Zarizana, how do we create positive messaging about women and girls' bodily autonomy, especially when it comes to understanding and also ending violence against women from a broader perspective?
Thank you, Tamina. In terms of messaging, I think it's creating that positive messaging about women and their body, about girls and their body especially, yeah, and tying it to dignity. Yeah, I think this has to be done more closely. The fact that human rights and women's rights and women bodily integrity is tied with dignity. I just want to quote you a recent Supreme Court decision from Pakistan. It's a strong decision pertaining to violence against women and the treatment of women following violence. Yeah, and this is what the court said, that the woman's right to dignity is an absolute right and is not subject to any law. Every person has the right to live. The right to live means the right to live with dignity. A person should live as a person, and no less human dignity hovers over our lives like a guardian angel. Therefore, the right to dignity is the crown of fundamental rights under our Constitution and stands at the top, drawing its strength from all the fundamental rights under the Constitution. As I said, this is a case pertaining to the mistreatment of women following violence. Yeah. So when we create that messaging, yeah, we have to move away from this idea of the contestation over women's body, the shame, or that the multitudes of control that we are putting over girls and our body. Yeah. And we look, for example, just look at moral policing about how girls are made to feel about our bodies, about our sexuality. Yeah, I remember growing up, it was very difficult when you compare yourself to a boy, a guy, who has more freedom, yeah, to express their, to have this bodily integrity. Yeah. We, under the idea of protecting our girls, yeah, we shield them, we do not teach them, and we actually restrict their growing awareness of their bodies. And that is the issue. When we do not talk to girls about relationships, and especially we do not talk to boys about respectful relationships. And this is how that positive messaging has to come in. I remember when I was with WCC, when WCC had a program talking about respectful relationship, it caused a bit of unease in certain schools, with certain principles that this is not something we should be talking about. But this is exactly what we should be talking about, how to have that respectful relationship. The other aspect of this is the idea that we have a lot of laws. Yeah, we have domestic violence law that's been around since 1994, I believe, and now with the sexual harassment bill. And yet, the societal thinking, I don't know that we have changed that much. Society is still a bit ambivalent about domestic violence. Yeah, research over again has shown that Malaysians actually think that domestic violence is sometimes justifiable. Yeah, and even research with legal enforcement officers, yeah, disclose this, that if our legal enforcement officers think that domestic violence is sometimes justifiable, how are we going to make the enforcement of the Domestic Violence Act effective? Yeah? This normalization of violence tied with, how we view moral policing, how we view victim blaming, how, when girls are sexually exploited or sexually assaulted, they are blamed for being promiscuous, yeah, or easy, yeah, or they should be the ones bearing the shame. Yeah, this has to change. Yeah, and this is actually a barrier to women, for women coming forward to report violence. Yeah, they lack the confidence that society will support them. Women lack confidence that even the legal judicial system will provide them justice. So positive messaging is very important. In my research in over 45 countries, respondents identified that gender inequality was the cause for violence against women. They also indicated that women do not report violence against women because they lack confidence in the police and the judiciary. In fact, a UN study found that the most commonly reported motivation for perpetrating rape was a sense of sexual entitlement, yeah, of men's sexual entitlement. Yeah. All this point to how wrong or how we have not put enough emphasis on creating this messaging about women's bodily integrity and autonomy and dignity and respectful relationship and respect for the woman's bodily integrity and body. Yeah, we need to change this mindset. We need to create a messaging to transform society by changing this mindset, which will bring to our modifying behavior. Thank you.
Thank you very much for that, Zarizana. Very important to contextualize domestic violence, violence against women, against, of course, the broader socio-cultural regions which cut across, as you said, 45 countries that you have done research in. In the interest of time, we are going to move towards the closing of the session. Of course, we do wish we had so much more to discuss with each one of you, but I would actually like to now ask for each one of your minute-long closing statements. Perhaps we could begin with Dr. Sanuta. Dr. Sanuta, what are your recommendations for Malaysia's short-term plans for achieving SDG 5 or gender equality by 2030? With a focus on, of course, women and girls' bodily autonomy.
Thank you, Tamina. We have aligned our strategies and programs in line with the Sustainable Development Goal 5 of gender equality by 2030, the Shared Prosperity 2030, as well as the 12th Malaysia Plan. Our short-term plan will be ensuring the successful rollout of the Anti-Sexual Harassment Bill. We know sexual harassment is a form of gender-based discrimination, and that focusing on this specific area would provide a practical foundation for drafting a gender equality bill later that we are hoping in 2023 in the national context and upholding the rights of women and girls. Thank you.
Thank you very much for that, and we look forward to that commitment being upheld, of course, by KPWKM and all partner ministries. YB Fuzia, if I could get your recommendations for Malaysia's short-term plans to achieve SDG 5, particularly, of course, through your lens with your constituents in Kuantan, perhaps.
The 12th Malaysia Plan specifically mentioned about gender equality, Malaysia's commitment towards gender equality, and I would put that as the halfway point between now and 2030, where we are expected to meet the outcome of the SDG 5, gender equality. So between now and 2030, we have 10 years and 5 years in between to achieve the 12 Malaysia plan. I think we are doing quite okay with regards to women in terms of education. Healthcare, yes, we are quite okay. We are not so doing so well in terms of women in the workplace. I think we need to improve on that, and we can improve on that, especially on equal work, equal pay, and then flexible hours, and then more sensitive workplace for women. But with regards to policy making, women at the highest decision level, I think we are way, way behind. And here we need the political will. We really do need the political will. And on behalf of my party, we have already incorporated it in our constitution, party constitution, to have a minimum of 30% representation. And we keep emphasizing, I keep emphasizing that it is not, 30% is not the ceiling, 30% is the floor. And we do have to make sure that we work towards that. And we have been seeing progress, and yes, we will continue to, in our commitment, and I hope in the GE 15, my party, I've put commitment to deliver 20 women MPs. So that's what we plan to do. Thank you.
Fantastic. The more women, the better it is for policy making and, of course, Malaysia's future and also pandemic recovery. Dr. Narima, I would like to ask you for your closing thoughts when it comes to achieving SDG 5, gender equality, through a focus on women and girls' bodily autonomy. Perhaps you could particularly touch upon the fact that child marriage has also shown some significant uptick over the pandemic. Our latest records show that out of almost 21,000 odd students that dropped out of school, around 445 of those were girls who actually left school to get married.
I love this question, Tamina, but it's very complex. SDG 5, gender equality, women empowerment. First thing we must realize, there are many facets to gender equality, and the targets and the indicators set out in SDG 5 has looked at most of those facets. So we're talking about things that both Sunita and YB has mentioned. We're talking about discrimination, we're talking about economic empowerment, we're talking about decision-making positions, and I'm glad there is now a parliamentary select committee, and we have a vision, at least YB has a vision, that we should go beyond 13% of parliamentarians by women currently to perhaps 30-40%. So those are the important aspects. Then the most important aspect, which is our theme today, is bodily autonomy and bodily integrity. That's part of gender equality. And Tamina, we have, the public must know, must accept this as the hard truth, that child marriage is a violation of bodily autonomy, and something must be done about child marriage. Since we are running short of time, let me just summarize by saying that I might like congratulate YB here. You were deputy minister at that time when the ministry made the plan of action to address the causes of child marriage. The 6 causes, the 7 strategies, the 7 objectives, the 17 strategies, and the 58 actions. So my parting remarks today is, all of us in this room, every constituency, you have a role to play in ensuring gender equality and looking at child marriage. If you look at those 58 actions, all of you can play a role there. Which are the low-hanging fruits? When I was chairman of LPPKN, I looked at the 58. This is what LPPKN can do. When I was recruited by UNFPA, I looked at the 58 actions again. This is what LPPKN, this is what UNFPA can do. So all of us have roles to play in ensuring gender equality, including in eliminating child marriage and looking at the 6 causes.
Thank you. Thank you so much for that resounding message, Dr. Narima. And moving on from there to Ms. Bileng, what are your final recommendations for Malaysia and perhaps Penang in particular's short-term and long-term plans for achieving SDG 5, gender equality, and achieving bodily autonomy for women and girls?
Okay, thank you, Tamina. Probably 3 things that top of my mind. One, I cannot say more about the need for women to women and girls to be interested and go into politics. If you look into the gender gaps index, this is the biggest gap that we have. We're only at 10.7%, you know. So this gap needs to be addressed, and I really hope that the government would put more resources and also more incentives to encourage even the political parties. You know, there should be some financial backing, financial support for parties to encourage more women to go into politics. That's number one. Number two, if you talk about empowering women and bodily autonomy, we should be looking into not a diverse approach, but rather more of a convergence. It takes a collective effort of the government, the CSOs, as well as the public themselves, you know. Government needs to put resources, needs to put policies in place, and CSOs are the one. I think they are tremendous implementers. Budget should be given to the CSOs, you know, to run the programs, as well as breaking the gender stereotype, and of course to change the mindset, and that also gets the public themselves, you know, to be involved. Last but not least, I think we should be also looking into the upstreaming strategy, not just targeting at those victims and all that, but also looking to the issues. The issues are actually at the upstream. Target our young children, you know, let them understand their body, what to do. You know, if they don't feel comfortable, if somebody touch you, it's no more taboo. You know, talk about sex and all that, it's no more taboo. The impact of this imprint, if they feel it from young, will carry with them for life. And it's not just that, they also impact the next generation. So these are the three things that I hope that we can work on it, and with it, hopefully, we can achieve gender equality by 2030. Thank you, Tamina.
Thank you, Bilang. A very resounding summary overall. And now, finally, we move to Ms. Zarizana. Zarizana, may I have your final parting thoughts and recommendations for Malaysia's short-term plans for achieving SDG 5 of gender equality, with, of course, a focus on bodily autonomy and what you had touched on briefly earlier, the socio-cultural norms which we've really seen come through during the pandemic.
Thank you, Tamina. What is interesting about the pandemic is it has taught us so much. Yeah? It has thrown out a lot of things that is not sustainable. Yeah? The way we have been doing things, the way that we've been looking at putting all this pressure on women, and, you know, women adopting the double burden. Even with the pandemic, things have not changed. You know, even when the husband has lost his job, things have not changed at home. So that idea of, even as we move out of the pandemic, the gaps and the pains that the pandemic has exposed, we have to look at that. And in that, I mean, is we have a lot of laws, we have a lot of policies. Yeah? What is effective implementation? Yeah? What is what does it mean for the government to effectively implement something, for the benefits to trickle down to the women who are the ultimate beneficiary of these policies? Yeah. So you have the law and the policies, and you have society and women who need, you know, to come together in this effective implementation. And in that, the law is a wonderful tool in educating. Yeah? The law and policy can educate, but that idea of bringing it and, you know, creating the messaging and the education and changing the social and cultural norm, and understanding that culture is dynamic, culture has to change in accordance with contemporary issues. Yeah. It's not disrespecting culture when we say that we live today in a different society. The social norms have changed. And that with the changing of the mindset and the transforming of behavior is what we need in order to bring real and effective transformation in gender equality to our society. Thank you.
Thank you. Thank you so much for that, Ms. Zarizana. And with that, Esteemed panelists, Dr. Sanuta, YB Fuzia, Dr. Narima, Bilang, and of course Zarizana, it's been such a pleasure taking us through this entire session. And of course, we look forward to all your invaluable insights coming out as resolutions at the end of today's discussion on prioritizing women and girls' bodily autonomy. I'm Tamina Kausji, and with that, I hand over back to Ms. Zoe.
Thank you very much, Ms. Tamina and panelists. Oh, what a fantastic and insightful discussion. I think that deserves a big round of applause to those of you who are here in the hall and also online. Now, ladies and gentlemen, we shall move on to the second keynote session, Comprehensive Sexuality Education, or CSE, and Bodily Autonomy. Now, our keynote speaker for this session is Ms. Siti Aisha Hassan Hasri. Now, Ms. Aisha strongly believes prevention is better than cure. As the founder of the SPOT Community Program, which stands for apologies, ladies and gentlemen. So I can't pronounce it as of this moment. I apologize again. She and her organization deliver comprehensive sexuality education for youth through age-appropriate and culturally sensitive approaches in the interest of preventing sexual abuse and exploitation. Ms. Aisha, the floor is yours.
Hello, my name is Siti Aisha Hassan Hasri. I'm here to talk about SPOT and the work we do. SPOT is a movement that provides comprehensive sexuality education through age-appropriate and developmentally appropriate and culturally sensitive approaches. So that's what we do. We're in the business of providing CSE. I started it in 2015. We use carefully designed modules to equip especially girls of the ages from 9 to 14 with confidence and resilience to make informed decisions regarding their mental and physical health and well-being. The idea to start SPOT came to me when I was studying in Universiti Malaya, UM. I was an enumerator for the medical faculty of the Universiti Malaya Medical Center, PPUM, tasked with collecting data from communities in PPR, which are the Project Perumahan Rakyat flats. So in the course of the interviews with numerous families, like more than 50 families, from children to parents, to grandparents even, I discovered the prevalence of dangerous attitudes, especially relating to issues around reproduction and sexual behavior. So I observed also how many of the children who were left alone for many hours, as parents had to work, both parents, right? Especially in urban settings, which is an unfortunate reality for most families, especially the lower income families. And of course, sometimes, as the scenes and media coverages that we see, the villages who are assigned to help, which surrounds them, to help raise these children, sometimes are not always a positive one. So I then started talking to a lot of people and did my research, and I also started working on modules. And these modules, the goal is to prevent, right? It's achieved by empowering young people to be aware of their body, how it works, and also their rights over it. So the topics that we cover in schools are hygiene management, what to wash, when to wash, and how to wash. We also talk about menstruation and menstruation management. We talk about mental health. We talk about puberty management with dignity, hopefully, for boys and girls. We also talk about sex. We talk about contraception, pregnancy, STI. We talk about consent and boundaries. We promote non-violent communications skills, which is very difficult to do with children. We also talk to them about negotiation skills, how to talk to your parents, how to talk to your teachers, how to talk to your peers, and in reducing violence as well, and the usage of violence. And also we talk to them about online safety and peace-building skills. So the peace-building skills ONSAT was really, really helpful, especially during the pandemic. So of course, the desired outcome of all our programs that addresses SDGs 3, 4, and 5 directly will be for girls to eventually be able to carry themselves with pride and with dignity. Because to me personally, this is very, very important, especially under the area of bodily autonomy, knowing that you have the right to your body, the right to your personal space, the right to dignity. We do this because we believe that girls should be empowered to speak for themselves, and also, of course, eventually on behalf of their friends, for others. They should be brave enough to ask for opportunities, and they should be able to internalize this knowledge that we provided for them and advocate for it. So, how have we done so far since 2015? The idea around how we are helping girls revolve around this 3 concepts, which is to spot, to stop, and to swap. The idea is to empower the children with useful information and prepare them through carefully curated activities. And we invite them to practice, to imagine and reimagine solutions and situations that will require them to think about and reflect on times that they might need to use the knowledge and information shared. So when needed, girls will be able to spot the issues. They'll be able to then stop and think and reflect before engaging with the issues, and then swap their approaches or attitudes to an approach that they think would then be the most safest, most comfortable, and most happiest with. So during the pandemic, we had to adapt, obviously, pivot, from in-person to online, from primary schools to secondary schools, and from only girls to both boys and girls. So from 2015 until today, we have educated 14,824 children, we have trained 359 volunteers, and we have been in 110 schools. This year alone, we had delivered our program in 30 schools, and it was really, really exciting because we had boys on board for the first time, and it was just, I thought it was going to be quite intimidating because boys at the age of 13 and 14 can be, as we all know, intimidating. But it was really, really a pleasant experience, and I left every session feeling energized, optimistic, and blessed and grateful. So this year, 30 schools, while managing an ocean of uncertainties. And of course, we also aim to complete another 30 schools in Q1, hopefully if all goes well in 2022. Just like mental health, right? Comprehensive sexuality education is considered as a soft issue to our society because a lot of the issues are mired in customs and traditions and censorship, just as the first panels had presented earlier on, compared to other more urgent and more measurable issues. So, as a society, we need to work hard on helping our children because currently there is a lack of high quality, age and developmentally appropriate sexuality and relationship education that may leave children and young people vulnerable to harmful sexual behaviors and also sexual exploitation, which is detrimental to the social and economic growth of our nation, as we all know. And to strengthen our effort, we need to start by choosing to accept, first and foremost, that our children are vulnerable and they need as much help as possible that we can give in order for them to be able to stay safe in real life, online, and to go through puberty with dignity in order to fulfill their potential as healthy and happy adults. Us as a society, we need to start looking at sex from a physical and mental health and well-being perspective, working on removing hypersexualization of the body, especially through media exposure and porn, and the word sex itself. We need to constantly choose to engage our children in comprehensive sexuality education and support the good work that's been done by NGOs and CSOs and the government and related agencies such as SPOT. We need to stop shifting blames and start believing our children. Thank you.
Thank you, Aisha. That was such an interesting opening keynote. Now we'll move on to a short Q&A session with our moderator, student activist, Ms. Ain Husniza. Ain, take it away.
Thank you, Zoe. And today I will continue with a couple of questions that I have for our Miss Aisha Hasri. So, earlier you shared with your experience as the founder of this sport community program and how you have engaged with a lot of students and school, even reaching as much as 110 schools and around 14,000 participants.
14,000.
Sorry.
But thank you.
So I have a couple of questions. With your experience with these students, I'm sure you have developed a couple of opinions, and some of it is, I want to ask you, how does the normalization of rape jokes in school violate bodily autonomy?
Very good question. Thank you so much, Ain. May I just say, I'm a big fan.
Thank you.
And thank you for doing this with me. So rape jokes, right? You said rape jokes in school. This is a very hard topic for me, and I'm sure it is very hard for you as well. But I'll just very quickly answer without being emotional. Rape jokes, unfortunately, normalizes sexual violence as something that is funny, that is permissible, and that is inevitable, right? It also normalizes the violations of boundaries, right? Of consent, consent is bodily autonomy, and the right to do what you want with your body, the choice to keep your body safe, the choice to have personal and physical space, the choice not to participate, the choice to wait. And this promotes sexual violence. Of course, we all know that sexual violence has a spectrum of it. Yes, there's one end, there's all this rape jokes. Oh, I'm just joking with you, that kind of thing. And the other end is rape itself, the reality of things. And any sexual violence, any form of it, is wrong. It is harmful, and it is criminal. So, short answer is, rape jokes in schools normalizes sexual violence, which is wrong and harmful and criminal.
Yes, exactly. I agree with you on the fact that even something as small as rape joke can slowly normalize and even make situation like the actual things like rape threat itself be happening in school. And that's what I experienced myself, so I completely understand what you're talking about. And my next question is, how is bodily autonomy central to the success of movements, for example, like hashtag make school a safer place?
Yay! Well, I'll just answer it also on a spectrum. I think it'll be very easy for us all to understand. So one end of the spectrum would be, so I'm talking about the wider impacts of us if we were to ignore, right? Because you're talking about how central is bodily autonomy to this. I'll talk about the spectrum of if we were to ignore. If we were to ignore bodily autonomy, on one end, it will be stress, depression, mood disorders, and of course anxiety. On the other end of the spectrum would be the permission and the power that is backed by society, because society permits this rape culture to use, abuse, and assault women and children violently. So your movement, Ain, is crucial in provoking thoughts, in promoting healthier, safer conversations about bodily autonomy, and it challenges our society to reflect on the norms that we have, right? And then to kind of challenge those norms and build new norms and customs and traditions, of course, whether or not it is current with the thinking of the 21st century, like the panel, I think it was Zarizana, that mentioned this, like we need to come here and be present in the 21st century, right? Whether or not that their attitudes are helpful, whether or not it is dignified, and also what to do about it. And of course, how do we course correct? See, when our society finally decides to honor bodily autonomy, right, across all social aspects, you can expect a lot of systemic changes, especially in the realm of human rights, with people such as yourself, your parents, and your peers and the sport volunteers. They're all about your age. I feel very optimistic, because you guys understand how and what kind of impact you're trying to achieve. And you will definitely make schools a much safer place, a better and more encouraging space for our future children, for all our future children.
Thank you, Aisha. And as we can see, bodily autonomy is definitely something that's really important, especially in movements like #Make School a Safer Place. It's one of the bigger bases that covers a lot of topics, especially in bringing a safer environment to students in school.
Correct.
So I was wondering, outside the aspect of movements, are there any wider impacts of ignoring bodily autonomy? For example, maybe vulnerability to violence?
Oh yes, most definitely. And I think, so for example, your job and our job is mainly to promote healthier ways and approaches to think about these issues, to discourage violence and to discourage, I think, rape jokes, which contributes to the rape culture. So I think there are many consequences that we have to think about if we were to not talk about bodily autonomy. I would say there are, like sexual violence, there are three main problems I can see. So one would be, it will be leaving, like you said, to violence, leaving children vulnerable to child sexual abuse and exploitation. Children, meaning from the ages of 0 to 18, of course in accordance to the United Nations Convention of the Rights of the Child. And then there's also two, is leaving children vulnerable to preventable tragedies, right? So first is abuse, use, manipulation, exploitation. Second is preventable tragedies such as unplanned pregnancies, child marriage, baby dumping, and infanticide. Third would be, of course, robbing children the potential of a better quality of life when it comes to the skills of healthy relationship building, when it comes to social and emotional skills, when it comes to sensitivity towards others, also self-confidence, perseverance, which eventually will create resilience. Overall, a mentally and physically stable health and well-being, I would think. So this is where what we do with sport comes in. CSE actually helps in influencing and encouraging young people overall towards strengthening their moral compass, towards advocating for a positive influence amongst their peers, towards developing a more wholesome and optimistic views and values long-term around the concepts of not just sexual and reproductive health, but also around the concepts of ethnicity, gender, sexual orientation, race, socioeconomic status, I would say also, employment, education, appearance, language, communication skills, family, physical abilities, religious beliefs, political beliefs, and other ideas that's available out there. I mean, young people think about a lot of things, especially nowadays. You guys are so woke, and everything is at the click of your thumb. So.
Yes, definitely. I think you summarized the wider impacts of ignoring bodily autonomy really well. And I'm sure with sport community program is as a basis about providing comprehensive sexuality education to children. I'm sure you have some experience of yourself about what the consequences, really are of failing to equip Malaysian children with this CSE.
Oh, the consequences. I think I kind of have listed the consequences of not providing a CSE. So mainly, as mentioned earlier, I think, preventable tragedies, which are unplanned pregnancies, underage pregnancies, right? And also infanticide, baby dumping. Of course, those are like tragedies. And there's also that part whereby the quality of life, mental and physical health and well-being will be affected, and also, as we all know, as young adults, it's a transient space in life. So if you don't invest in education, especially comprehensive and sexuality education, during the time that you are in adolescence, it will affect you as an adult, right? And there's a lot of social and emotional issues that will be also affected in long term. And we are, again, in the business of prevention, in trying to see if we can create an intervention in order for this to not happen.
Was there any personal cases, like during your time of during the community program, where you can share a little bit about these children, maybe some of the stories of how they were struggling with the lack of CSE?
Ooh, okay. I'm not very good at telling sad, sappy, sob stories. But there had been. So your question was lack of. Sorry.
With your experience, with you being on the ground, like meeting the students.
Any stories?
Yeah, any stories about like that you can share?
Well, okay. So this would be. There's a disclaimer here. Would be, I would say, I will share stories from the time that we actually deliver in person, because doing online is a different type of stories that happen. But yeah, in person. So there were, I would share with you 3 stories that stuck with me until today. Number one was during the time that, I think this was in the year 2016. I was in a school, and there had been cases of children bullying other children, and there was actual sexual assault by other children. So this child is 11, and he was bullied by 5 other children who were 12. And it became a police case. And that was why I was called, because the teachers at that point of time think, oh, there is this case, therefore we need to take action now to provide the children with CSE, comprehensive sexuality education. So the victim, the survivor was, the broom was actually inserted into his anus in school. This happened on school grounds, and this is primary school in Malaysia, within central Malaysia. It's not even that far away from here, this school. And then there's also cases of girls jumping from school buildings because of boyfriend-related stuff. And these are primary school students, okay? Boyfriend-related stuff, parents-related stuff. Oh, I wanted this bag, this pencil case, and I couldn't get it, and therefore, blah. And there's also this one story about this girl. She was crying, and then we saw blood, and then we realized, oh, she's having her period, she's scared. So we spoke to her about, managing your menstruation and things like that. And then we see that she's still unsettled. And then we asked her, oh, why are you still upset? Why are you still crying? Here's a pad. I've already showed you how to put it on, so you can go to the washroom. I'll walk with you to the washroom and help you prepare. I'll be outside the bathroom door, don't worry. And then I realized, because it was very difficult for her to say this. She didn't have any underwear, actually. And this, again, is not that far from here, the school, in KL itself. And so after that, I think this was the time that I came face to face with a lot of issues of peer poverty, a lot of issues of sexual assault with children, and also a lot of issues of, whereby teachers and school staff actually were the perpetrators of sexual assault and sexual violence against children. So yeah, those are the stories that stuck with me. I hope I answered your question.
Yeah, I'm sure from your sharing, we can see how much these issues actually affect our Malaysian students and how it's a problem that's happening in a lot of schools, and how comprehensive sexuality education can really help these students. Because, for example, in your story itself, like the student didn't even know anything about period, like she didn't even have any underwear, and you can see how much education would really help these students. And I'm really, really inspired by your story and your advocating and what you're doing right now. I think that's all of the questions that I have for you, Aisha. Thank you so much for your session. It's really insightful, and I think I'll hand back the floor to our MC.
As are you, I'm very inspired by you also, Ayan. Thank you so much for all the work you are doing.
Thank you.
Thank you, Zoe.
Aisha and Ayan, that session really brings home the importance of CSE so that young people, especially girls, fully understand bodily autonomy from an early age. Now, ladies and gentlemen, we will take a short screen break for 15 minutes before continuing on with the second plenary discussion on another important bodily autonomy issue. So see you back here in 15 minutes.
Welcome to the future. It is 2050. In Asia Pacific, 1 in 4 people are above the age of 60. The majority of them are women. Is she healthy? Is she financially secure? Is she active? Is she happy? Let's rewind. Today, the world's demography is rapidly changing. Women are having fewer babies. People are living longer. Asia Pacific is at the forefront of population aging, but is the region growing older before it grows richer? To bridge the income gap, we must bridge the gender gap. Every girl should have access to quality healthcare and education. She should be equipped with skills and knowledge that set a foundation for life and love. Every woman should have access to rights-based family planning so that she can choose her lifelong pathway. She should be able to decide whether she wants to have children, and if so, when, how many, and with whom. She needs to be able to deliver her baby safely, improving her long-term health as well as the health of her child. She needs to be safe from violence and be in healthy and happy relationships. She needs to be given equal opportunity to actively contribute to society. Only then can she age with dignity. Only then can we age with dignity. A life cycle approach paves the way for a healthy life, a prosperous life, a happy life. We need to start early. We need to start now. There's little time to lose.
Sexual harassment? Let's talk about it. When did sexual harassment begin? According to the internet, it was only recognized officially by the USA in the 1970s. But who's to say it wasn't happening before that? As early as the 8th century, plenty of art pieces depict acts of sexual misconduct, even noting down the history of sexual abuse against a man. Yet, only in the last 50 years has it been recognized as a crime. Sexual harassment has been defined as unwelcome sexual advances, requests for sexual favors, verbally and physically. It could look like something seemingly innocent, a graze of the shoulder, an unsolicited comment on appearance, but anything that is unwelcome by the recipient makes it harassment. According to UN Women, 35% of women globally have experienced physical and sexual abuse, and these are only the ones that have been reported. And in the Asian region, sexual harassment is higher due to public places being dominated by men. Another research done by UN Women states that 4 in 10 women in Asia have been sexually harassed in their lifetime. Sexual harassment is no stranger in Malaysia. Despite efforts to curb it, statistics by PDRM have shown that sexual harassment has grown between 2013 and 2017. Amongst them were mainly those aged 18 and above. And those numbers also include men. These figures only show cases that were reported. There is an extremely high chance that many acts of sexual misconduct and harassment have gone unspoken. But why? Why is it so difficult to report sexual harassment? Factors that contribute to the difficulty of reporting include the obvious social disparity between men and women in the society, and also the hierarchy in an institution or workplace, which all adds up to the biggest factor as to why these cases go unreported. Victim blaming. The unfortunate practice of asking what the victim was doing, where the victim was, what time of day or especially at night it happened, drives the victim, or rather survivor, into a state of mind that it was their fault, resulting in their trauma going unreported. Malaysia is one of the fastest growing countries in Asia. To successfully move forward, we need to make sure we cover all aspects of livelihood and well-being of the people who make the country. More women are getting involved economically, socially, and politically. But there are no laws to protect them from potential harmful environments. Even though the country has recognized and defined sexual harassment in the Employment Act, the Act doesn't actually protect anyone. 9 years ago, in 2011, the Sexual Harassment Bill was proposed. And today, we are still fighting to have it passed by Parliament. Check in here for more info on sexual harassment.
Hi, I'm Susan Lancaster. Physical abuse, mental abuse, emotional abuse. Please let's stop violence towards women now. I'd like to read you a poem by an unknown author. For the women with night terrors, bruised hips, fat lips, bodies that are turned into statistics, wrists that are put under a microscope. For the women who have had the courage to be loud, for those who have had the courage to be quiet, for the women who seize up when they hear a distasteful joke, and for those who have spent too long laughing along, because it was easier to say nothing than to say anything at all. For the women who sleep with all the lights on and don't leave the house after sunset. The women who feel unworthy of love, unworthy of legalities, unworthy of a voice, unworthy of their own energy and time, never mind that of others. For the women who just want to simply be women without fear, without pain, without their guard up. For the women who just want to simply be. Me too. So please remember, you have the right to say, my body is my own. Badanku milikku. Let's end violence towards women now. Thank you for listening.
We talk about sexual assault, but we don't talk about the assaulter. We talk about domestic abuse, but we don't talk about the abuser. We talk about violence against women, but we don't talk about the men who inflict violence against women. Bodily autonomy is a human right. But it means very little if we live in a system that protects the men who don't respect those rights, if we live in a culture that downplays rape jokes, that asks you what you were wearing, that treats reports of assault as trivial. It might be hard for you to think about violence against women. But what if it happened to your mother, to your sister, to your friend? What if it happened to you? We need to stand up, we need solidarity, we need to come together to stop violence against women. We need to create a society where everyone is treated as equals, everyone is safe, where everyone feels welcomed.
Hello, my name is Rina.
And Chloe Mayton.
Yes, my child. Now, if you don't feel nice, you don't want to give someone a hug, but they're asking you for a hug, like an auntie or an uncle. Are you allowed to not give them a hug?
Yeah.
Because?
Because it's your own body. If you don't want something for your body, then you don't have to do it.
If you don't feel safe, you can say, sorry, I don't feel safe. Can I give you a handshake instead, right?
Yeah.
So when we were young, we were always told to give hugs to aunties and uncles, no matter how we felt. Nowadays, we know a bit more and we respect their bodily autonomy. This year's theme is bodily autonomy. Do you know what that means? My body, my own. You get to make up your mind about where you take your body and how your life and future goes. So that's the basic of human rights. If men and women around the world know the essence of bodily autonomy, just like how she uttered it, then domestic violence shouldn't be an excuse. It should not be exacerbated by the pandemic like it is right now. So, along with our future generation, this should be normalized. What do you say?
My body is my own.
Hi, my name is Damia and I am 15 years old. Being scrutinized like you're a prize, being perceived as objects, being told what to do and what not to do with my own body. I can show you strong. I can fight for you. I can reach for the stars if I want to. And all I ask for is a land where I am not being blamed for men's problems, where I am not being judged for supporting feminists just because you think it's only about man-hating. And I am every woman who have to think like a man, but to act like a woman. Girls, boys much slower than you. Cut them some slack, we were told as children. Boys, girls mature faster than you. View this as a sign of foresight and leadership. It's seldom heard. Today's world is one where anything may be fixed or faked. But understand how we were born with insecurities. We were taught to vary on certain things. Never touch my body without my permission. And I shouldn't have to carry a baby in me if I don't want to. My womb is mine, and no one can use it without consent. Any alters I make to my body to make me more comfortable is my choice and my rights only. And I am every woman. She who writes the movie owns the script and the sequel. So why isn't the stealing of my rights made illegal? I am mine and I belong to me. And I am every woman. And that is our persuasion. Our persuasion can build a nation. Our persuasion is endless power. Our persuasion is without love. And with love of our persuasion, we can devour.
Welcome back, ladies and gentlemen. Thank you for still being here with us. It's now time for the second plenary session, Understanding Bodily Autonomy as a Basis to End Violence Against Women and Girls. Now, our moderator for this session is none other, Yang Berhormat Puan Nurul Izzah, Member of Parliament for Pematang Pauh.
Assalamualaikum warahmatullahi wabarakatuh, and hello everybody. Hi, my name is Nurul Izzah Anwar. I'm the Member of Parliament for Pematang Pauh, and we are all feeling very privileged here today because we're here, myself, of course we have to my left Miss Sumitra Visvanathan, Women's Aid Organization's Executive Director, and also Nisha Sabanayagam, AWAM's Executive Director, all very important ladies to address key issues with regards to bodily autonomy, and Dr. Lai Suat Yan, our Coordinator and Senior Lecturer in the Gender Studies Program, Universiti Malaya. And online, if you can take a look, my gang from Penang, Karen Lai, Women's Center for Change, is also our program director. And ladies and gentlemen, everyone who is listening in, I think it's apt that we start with a quote again to reiterate what Natalia Kanem, the UNFPA Executive Director, has stated, that the denial of bodily autonomy is a violation of women and girls' fundamental human rights that reinforces inequalities and perpetuates violence arising from gender discrimination. It is nothing less than the annihilation of the spirit, and it must stop. So without further ado, allow me to call up who wants to speak first. That will be you. Sumitra, you're on stage now.
Okay, so morning everyone. My name is Sumitra Visvanathan, and I'm the Executive Director of Women's Aid Organization. So thank you so much, YB Nurul Izzah. I want to start by saying, sharing with you some really important numbers, okay? Now, this is something that might shock you a bit. Women say no when they actually mean yes. This is in the context of rape. Women say no when actually they mean yes. In Malaysia, 73% of respondents to a survey agreed with this. 73%. Women do not take care of themselves properly in how they act and dress. And that is a reason why they are raped. How many percent Malaysians agreed with this? 50% of Malaysians agreed with this. Okay, so today we're talking about bodily autonomy. We're talking about rights. We're talking about violence against women and girls. But you know what? Fundamentally, the baseline is what we need to know. And we talk about baseline, that means what do Malaysians really think about gender equality, about violence against women, and about what we can do as a community to address it. We need to know what the baseline is. So WAO actually did do a survey that addressed and tried to understand some of that baseline, and it was very worrying, extremely worrying, in fact. But there was also, a little sliver of a light in that dark cloud. So I'm going to take you through it now. Right? Okay. So, understanding bodily autonomy as a basis to end violence against women and girls. I want to first I want to Oops, I broke it.
It's a very important survey. I think, yeah, it just showcased what we have to work with, what we have to grapple with. Yep. And I think everyone who's listening right now, you really need to look at the survey WAO conducted, because it really has a lot to do with what we can do as the community, as whoever we are in our respective capacities to change that. Because as long as you have people's prevailing prejudicial perceptions, it's going to have a huge problem and multiplying effect. Yes, okay.
All right,
got the slides
wonderful.
now.
So before we get there, I wanted to just really quickly look at the pandemic and the impact that it has had in gender equality in Malaysia. So it has worsened gender gaps and in a whole range of different areas, but specifically gender-based violence, workplace, women's employment rights, SRHR, and children and girls' rights. Okay? So look at this graph. Look at this graph. So this is like regular hari-hari la your day-to-day WAO calls. And then you have the MCO. Okay? MCO starts, it goes up. And then it gradually goes down a little bit, but it stays static. So I will tell you that from the time of the MCO or the pandemic in March 2020 up to the end of this year, WAO would have addressed 15,000 cases of violence against women and girls. Not just domestic violence, but mostly domestic violence. 15,000. Okay? That's a lot. So from the what we've done over the pandemic since March 2020, there's a whole bunch of things that we have learned. But today I just really want to focus on two things. Number one, think about those cases. 15,000 cases, all right? GBV is so much more prevalent than previously documented. And we can go into why this is the case, why women don't report, why access is not as easy as it should be. We can go into all of that, but really we don't have time for that right now. So I want to draw your attention to point number 6, and that is disrespect for bodily autonomy and violence-endorsing attitudes are prevalent, and these are the persistent drivers of GBV. Okay? We need to address violence-endorsing attitudes in Malaysia. And what is that? What does that say? What does it mean? These are attitudes that justify, excuse, minimize, or trivialize physical, sexual, or other forms of violence against women, blame women, hold women responsible, and it is expressed by influential individuals held by substantial number of people to the extent that it creates a culture. Now, every single day, we read about or hear about influential people in our community expressing violence-endorsing attitudes. We hear it in Parliament. We hear it out of the mouths of ministers. We hear it from community leaders. We hear it every single day that is representative of a culture. And WAO, what we've done is we tried to get the evidence. So Dr. Narima earlier had talked about data, how important data is. Data is so important. We know from evidence that comes from our lived realities, but we need to have concrete data, and that's what we tried to do through this attitudes survey. And this is what it tells us. Only half of Malaysians are likely to oppose violence-endorsing attitudes and support gender equality. Half. There's a disconnect between knowledge and practice. We excuse perpetrators. On the one hand, we are able to recognize this is violence, this is domestic violence, this is sexual harassment, this is abuse against a child. We are able to recognize it. But then we excuse. We provide justification. We accept. We normalize. 53% believe that domestic violence is a normal reaction to everyday stress and frustration. Really? Then again, here's that number. Women say no when actually they mean yes. Really? Rape happens because men are not able to control their sexual desires. How many people said that is indeed the case? More than 80%. Really? Really, Malaysia? We don't acknowledge that gender inequality is a problem. Women exaggerate how unequally they are treated. Women wrongly interpret words or actions that actually are innocent, but we wrongly interpret it as sexist. Discrimination against women is no longer a problem in workplaces. Really? And we tend to undermine women in everyday life. Men should control the relationship and become head of the family, 80%. Women prefer a man to be in charge of a relationship, 85%. You know, okay, then I want to come to that little sliver of silver in that dark cloud. Malaysians are likely to oppose child marriage. 70.3% of Malaysians oppose child marriage. Thank God for that, right? There's a start. At least there's a start. So, hope. Just like Pandora's box, she closes it on time. Everything else is released, but she manages to trap hope. So, this is hope, okay? We oppose child marriage. We oppose child marriage, so let's hope that it's not that much of a leap towards recognizing that a woman has autonomy over her own body. Thank you.
Thank you so much. Thank you so much, Sumitra. I think that was very shocking, certainly, because in our session where we talk about understanding bodily autonomy as a basis to end all forms of violence against women, I think this perspective of WAO is so crucial. You're also looking at surveys and what we're dealing with in the Malaysian ecosystem. And to also realize, perhaps because the civil society have been campaigning for so long against child marriages, that it's come to a fruition. Because if you raise awareness, and I hope through bodily autonomy, by raising awareness, you have more people who understand the importance of ending all forms of violence. So, and also looking at women and respecting and really according dignity to where it's supposed to be. So our second presenter is our Nisha Sabanayagam from the All Women's Action Society, the Executive Director, no less. And she will be presenting. The focus is again on the famous or infamous period spot checks, school, safety online, and of course gender-based violence. Over to you, please, Nisha.
Thank you so much, YB Nurul Izzah. Thank you everybody for having AWAM today at the Malaysian Women and Girls Forum. Thank you so much, Sumitra, for that really eye-opening presentation. And I'm glad that you ended with a silver lining, because unfortunately the numbers that I have are probably going to destroy that silver lining a little bit, because data is power. And we are going to talk a little bit about some of the surveys that AWAM has carried out, especially concerning sexual harassment and also the period spot checks. Just to go back a little bit in time, in history, in 2020, when the pandemic happened and the movement control order was ordered by the government, AWAM started to notice a little bit of a spike in sexual harassment cases that were coming to us, especially online sexual harassment. That was also the year that women's rights organizations really wanted to have the sexual harassment bill to be tabled in December 2020. And we ran a paper petition, we ran an online petition, we basically ran a campaign. And 17,000 people signed our online petition wanting the sexual harassment bill to be tabled. So this really shows that the Rakyat really understands that sexual harassment is a problem, and they really understood that there was a need for a comprehensive, holistic bill. In 2020 also, we saw the really bad effects of online sexual harassment. We had 2 young girls who actually committed suicide because they were bullied and sexually harassed online. And these were young girls in their 20s, in the prime of their life. We also saw something that was really quite scary for Malaysia, where we saw groups of men who got together on Telegram and formed misogynistic sort of like cults, where they would talk about women in the most awful ways. And sometimes these women were not women that they did not know, it was women that they knew, and it even involved members of their families. So it was a really, really scary time for us, especially when we got people coming to us asking us to support them on these cases. And then when 2021 rolled around, it was business as usual. You know, Malaysia was still trying to deal with the fact whether we would have a movement control order, whether we wouldn't. CSOs were really worried about whether Parliament would actually come into a sitting or not, which they didn't. And then April 2021 came around, and Ain Husniza came onto the scene and brought with her a whole, she just opened the doors towards the whole issue of rape culture in schools. And at the same time, I guess, you know, the universe really works in mysterious ways. Seriously. At the same time, in April, there was a slew of people who started talking and opening up about how they were sexually harassed in school, especially in the form of period spot checks. And for many of us, this was just so new. But apparently, there is a huge subculture of period spot checks in Malaysian national schools. And also, there is a huge culture, as what was shown by Ain Husniza, of rape culture in Malaysian national schools. And not just national schools, actually. We are talking about basically the school system here. So it so happens at that time when there were so many women who wanted to speak about their period spot checks and their sexual harassments in schools, this is where social media really becomes a tool that we can use for real great advocacy and also to get people to open up and talk about their issues. We worked with an organization called Save the Schools, which was just a bunch of young women who got together, put out a really simple Google sheet out for women and for young women and also for young men to talk about issues of sexual harassment, period spot checks, bullying, and abuse that they received in schools. And what we got during the time period of 26 April and 13 August, just in a few months, we got 770 testimonies. And just to let you all know, testimonies are still coming in. So this is a little bit of a disclaimer. Because it was carried out via a Google form, some of the information is incomplete. But you know, where there's smoke, there's fire. And this is a snapshot of what's happening in our schools, okay? So the survey showed over 1,400 violations. Most of them involve sexual harassment, followed by period spot checks. The incidences were shared with us, with the survivors. And as you can see, it's happening all across the country. Okay, it's not just in Kuala Lumpur, it's not just in Selangor, it's happening all across the country. And what's even more shocking is some of them are still in school. 199 of those young people who wrote to us are still in school right now. Most of them, 70% of the sexual harassment violations involved child survivors, 17 and below. And what's really scary is almost 90% of these violations are occurring in our primary schools and our secondary schools. Of course, most of the survivors of sexual harassment are female. And out of all these perpetrators, 41.1% were figures of authority, and 87% of these figures of authority were men. So men were mainly the perpetrators here. Over 80% of the sexual harassment violations that happened in school were not disclosed or reported to anyone during that time that it happened. So this shows a really big gap in our school systems on how they deal or how they even prevent and how they even have a conducive atmosphere for women and girls and boys to actually come forward when they need to actually make reports of sexual harassment. We don't have a conducive, safe systems in the school at the moment. When it came to period spot checks, 41% of them said that most of the time the teachers would just grope them to find out if they actually had their pads on or not. And this groping was not outside the underwear, sometimes it was also inside the underwear. So there were some stories that were so bad that even the people who were doing the analysis for AWAM got quite distressed and quite traumatized. Of course, almost 80% of all the period spot check violations involved, again, people who were 17 and below. So we're talking about children. So imagine how traumatizing it is for a child. And how does that affect that child as she grows up? Again, it happens mainly in primary and secondary school. 94.6% of all period spot check violations occurred in primary and secondary institutions, schools of learning. And what is even more scarier is the perpetrators were teachers themselves. Okay? 72.7% were figures of authority, most of them teachers, and most of them were women. And only 6.8% of the survivors of period spot checks actually decided to disclose or report this to someone. And unfortunately, all those who reported got really severe consequences or were told to keep quiet. Don't make a big deal about it. Or we're going to kick you out of school. Don't cause a problem. Okay? So that's what's happening in our schools. And I'm going to just take you out a little bit to a survey that we did with SendGPS on sexual harassment. And this was a national survey. We surveyed over 1,000 women all over the country. Yeah? And this is purely a survey on sexual harassment, okay? So I'm going to start from the lowest percentages going up to the top, okay? 25% of women said that they were scared. They have been followed as they were going home, okay? 37% said they felt very unsafe while being treated by a male doctor. And I think a lot of women can identify with this. This is the big one. 41% said that they have received unwanted sexual harassment messages or sexual messages on social media. I personally believe the number is more than 41%. 52% said that they were not safe watching movies alone in the cinema. 57% said yes, they have experienced unwanted touching, for example, placing their hands on the lower back or on the knee. 57% said they have experienced being sexually harassed verbally when walking home on the streets. And I, again, believe this number is actually a lot more higher. 68% said they do not feel safe driving home alone in the night. And that's really quite scary in a country like Malaysia, to think that women don't feel safe driving home alone in the night. But here's the kicker. more than 70% said that they had to change their travel route or routines because they were afraid of being sexually harassed. More than 70% said. That's over 700 women who were surveyed who actually said this. And of course, we come back to a full circle again. 44% of women said that they had actually experienced or witnessed a teacher making sexually provocative jokes. Going back once again to Ayan Husniza's case, right? When this came out in the newspapers, we got such a backlash from the National Union of Teachers. And kind of going back to what Sumitra said as well, and the WAO survey about people's attitudes. Immediately, the National Union of Teachers said that it was, I believe the term was, it was a disgusting survey. But, you know, when there's a problem, you need to just accept reality and start figuring out how you can solve the issue. Don't immediately get so defensive. Why are we so defensive when it comes to issues like sexual harassment or domestic violence? It is a problem and it is a reality of life, and we actually need to do something to change it. And to be honest, there are ways and there are methods that we can actually implement to actually get this issue to be something that's not going to be such a huge social problem in this country. Just sharing a little bit of our case numbers. We're not a really big NGO, we're actually quite small. I actually work with about 5 or 6 people when we run our case, when we run our services, where we get people to come to AWAM and tell us about their issues of gender-based violence. For sexual harassment alone, in 2021 so far, we've received 152 cases, and this is almost already double the cases that we received in 2020. And because online sexual harassment was such a big deal in 2020, in 2021 we literally had to, by 2020 we literally had to form another section in our database just to handle sexual harassment cases online. Another thing that we do in AWAM is that we look and we try to monitor the number of cases of gender-based violence reported in the media to date in 2021. And we try to monitor as many news sources as we can, mainly English and Malay news portals. For this particular graph, we looked at 43 newspaper sources and media sources. And you can see that the highest number of cases when it comes to gender-based violence reported in the media is rape. In 2021 to date, so far, there has been 140 cases of rape reported in the newspapers. And these are only reported cases. Okay, for every one case that is not reported, I've heard that the data could be as high as, it includes 5 cases, it means that there are 5 cases that are not reported. So imagine 140 cases reported, right? Just think about that number. And then let's think about this. 140 cases reported in the media from January to November. Okay, when you divide that, what you get is 12.27 rape cases a month. And when you divide that even further, what you get is about 3.0 rape cases a week. So every alternate day, each week, this year, since January, a person has been raped, and it has all been females. And that's what we have reported. And I'm going to end my presentation on that note. Thank you very much for your attention.
Thank you so much, Nisha. I think it was a very sobering end, but it also struck me when you talk about child survivors, because government schools or national schools are one of the ways where our children can have an equal opportunity at mobility in later life. So you want it to be the safest place, not just for kids of the people we know or part of our family, but kids everywhere. That's a basic right. Now I'm going to turn to our Karen Lai from WCC, who has a presentation ready specifically to showcase what are the efforts to tackle gender issues structurally at a state level in Penang, and then we'll have a nice conversation between all our panelists, and of course to discuss further on bodily autonomy. Please, Karen, go ahead.
Thank you very much. Good afternoon and salam sejahtera, YB Izzah and fellow panelists and dear friends, Sumitra, Nisha and Suat Yan. Wonderful to see all of you again. How is everything over there? I feel privileged to be the only one without a mask, but I really wish I could see all your smiles in person. Okay, allow me to share my screen. And today, I would like to talk about the roles, recommendations. Apologies for that.
This is one thing that happens across the social strata. No matter how big and successful the organization is, you're always going to meet some challenges, technical online challenges.
Sorry.
Yes, we got it.
Yeah.
Great.
Are you okay? I'm back online.
Yes, you are. We can see the slides. Please go ahead.
Thank you. Thank you. Yes. Okay, so today I'd like to talk about WCC's work to end sexual and gender-based violence. I'll talk a little bit about the organization and the work we do. Then I'll highlight some issues that cropped out as far as COVID-19 and gender-based violence is concerned, involving women and children. And I'll go on to share a few resources that we've developed recently to address the issues. Yeah? So first, a little bit about us. WCC is an NGO in Penang, Malaysia, and we were established in 1985, so we're 36 years old. Our mission is to eliminate violence against women and children. So we support not just girl children, but also boy children who are also vulnerable to sexual violence. Yeah, I'll talk a bit more about that later. We also empower them on their rights, and we aim to realize gender equality and social justice. We have 2 offices at the moment, one on Penang Island and the other on the mainland. And as you can see from the photographs up there, we are diverse. We are multi-ethnic, multilingual, and also intergenerational. 80% of our clients come from the B40 category. Many of them earn below 3,000 ringgit a month. Significant number earn no income whatsoever. Many of them are children, sadly. And our interventions are grounded in realities based on the cases we handle. So we have 3 core areas of work: services, outreach, and advocacy. Yeah? So we practice an integrated approach to change. What do we mean by that? Through our services, we support individual women and children directly through crisis intervention. They are essentially survivors of sexual and gender-based violence, and we support them through counseling, shelter, and court support, working very closely with the agencies involved. Through our advocacy, we address substantive and structural barriers to equality, where we work closely on the laws together with our sister organizations in the Joint Action Group for Gender Equality. AWAM and WAO are close partners. Work on policies as well, such as we are currently working with the Ministry on the Domestic Violence National Committee. And a lot of our work centers on structural changes within the criminal justice system. And last but not least, and really what we're trying to do today, is outreach, where we're aiming to raise awareness and address these cultural barriers that keep perpetuating the problems. For example, through victim blaming and stereotypes, which Sumitra and Nisha have both so eloquently articulated. Yeah? So since 1985, WCC has supported and educated over 150,000 women and children against violence in multiple languages. And those are just a snapshot of the photos of the lives we have touched, including the woman at the front, Siti Khadijah, who is a survivor of domestic violence and who is today the proud owner of a small bakery business. Yeah, and she's stepping up to support other survivors as well. Now, I want to talk about some COVID-19 data trends and issues that are worrying. But what I want to say is COVID-19 merely exacerbated existing inequalities. It didn't cause it, certainly, but it made things worse. So first of all, right off the bat, we know that there has been an increase in domestic violence. During the first MCO in 2020, we handled 80 domestic violence calls, which is a 20% increase compared to the earlier 2 months. Yeah. And I think this is no surprise. This is a trend not only across the country, across our sister organizations, but also globally. We had a total of nearly 160 domestic violence cases in 2020 and over 306 cases between January and November this year alone. Now, around 80% of victims are women, making it a highly gendered crime. And we know that the risk and severity are exacerbated in lockdown. Next is the increased risk of child sexual abuse. And here I just want to highlight a few key points that we've observed from our work. Yeah? First of all, the vast majority of sexual violence victims, around 80%, are children. And this is borne out not just in our statistics, but also the national statistics that we gather from the police. In 2020 and 2021, Child sexual abuse cases formed 70% of the court support cases that we handled. Yeah? We handled around 70 cases per year. Last year, nearly 40% of these victims were between 7 to 12 years old. And this is seriously disturbing. I mean, you're looking at extremely young children, yeah? And the number of boy victims also doubled in 2020, raising this on our radar as an important area for intervention. We know that perpetrators are usually known and trusted persons. This is certainly the case when it comes to children, yeah? Often they're caregivers and trusted adults and family members. In our cases handled during the MCO between January to March this year, we noticed that 35% of the abusers were fathers and stepfathers. And this is clearly a very scary and heightened risk during lockdown when children aren't able to go out and access help or even physically contact or tell somebody else like a teacher, yeah, or a friend. Delays in case trials are a concern, delays in case trials due to COVID-19, because as you know, there are postponements in the court and so on and so forth. So we can't go on with the trials, and this leads to a delay in access to justice for victims and their families. Harian Metro reported in July 2021, police statistics for the last 3 years, 2018 to 2020, that there were nearly 7,000 child sexual crime cases reported. Mind you, these are just the reported cases. An average of 6 victims a day, many of which involve online grooming through social media applications. So this is what we're dealing with today. The third trend I want to highlight is an increase in online violence against women and children. In 2020, WCC handled 32 hotline cases of sexual harassment, and 60% of them involved online violence, okay, some form of digital violence against the victim. Online violence was also observed in domestic and intimate partner violence, for instance, where partners threatened to disclose intimate photos and so on, yeah? From January to June this year, we recorded 18 ICT violence cases. And again, I want to emphasize that much of the violence that occurs against children and teenagers happens in the online space. So we're looking at this new space, or this new site of violence against women and children, girls in particular. So how has WCC worked to address the issue? I think like the rest of the world, we had to pivot online. So during COVID-19 in 2020, we embraced digital technology, therefore expanding our reach and impact nationwide. Yeah? This was at the beginning of 2020. And since then, we have produced online storybooks, posters, awareness-raising videos, and multiple webinars and online trainings on issues related to gender-based violence, reaching millions, including families and communities in 6 languages. So I share there a snapshot of some of our work. The 2 books you see above there are Lisa and Her Secret and Yusri and His Secret, which are user-friendly online storybooks teaching children about how to respond to child sexual abuse. Yeah? And it mirrors our OK to OK program, outreach program for children, where we teach them about bodily autonomy, body safety, and how to react, yeah? When you are inappropriately touched by an adult, for example. So those books are published in 6 different languages, including Kadazan and Iban. The next there you see is a poster. Last year we launched a campaign about domestic violence being, like COVID-19, a public health issue. So we launched these posters, thought-provoking posters in multiple languages. Then you see we have multiple webinars, as well as the video screenshot that you see there is a video we produced called The Shower about victim blaming. So we've done a lot of work, and I would encourage you to visit our website and also our social media pages to learn more. I want to highlight here 2 resources that I'll be talking about a bit later. The first is our Victim Support Services report, which we have literally just launched about an hour ago. Yeah, so that poster is up there. It's called Standing with Sexual Crime Victims, WCC Victim Support Services, where we highlight the impact of our victim support services, including our counseling support, as well as our support within the criminal justice system, accompanying victims to court and so forth, from 2015 to 2019, comparing it with an earlier study we did on sexual crimes in the Penang courts from 2005 to 2007. Now, despite research limitations, when we compare the two sets of data, essentially cases where there was no support earlier, about 10 years ago, versus the current cases with support, we found some promising key findings, namely an increase in the conviction rate of 30% currently versus 4% before, as well as a decrease in the discharge not amounting to acquittal rate of 30% versus 45% previously. So the report contains recommendations to strengthen victim support services nationwide, and it's available at our website at the URL stated there. Finally, I'd like to highlight our new cyber safety guidebook for teachers and parents. I think this is a very important component of teaching bodily autonomy, especially to children and teenagers who are increasingly depending on digital technology for their education and social interaction, especially in COVID-19. Cyber Safety is a user-friendly illustrated guidebook, wonderful illustration by our talented artist Faziati that you can see there. And it raises awareness on 5 key types of online abuse against children and teens: grooming, sexting, cyberbullying, pornography, and cyber stalking. It also talks about red flags of online abuse, how to handle disclosure if it happens, and also the long-term impact on children and teenagers. And we were privileged to work closely with the senior pediatrician and child rights activist and expert, Datuk Dr. Amar Singh, who wrote the book. The book is also available for download at our website. Okay. So thank you very much for your attention. This is the information of our organization, our social media and website details. And of course, we welcome any kind of support for our work. I'll stop there and I look forward to sharing more perspectives later.
Thank you so much,
Thank you
Karen.
very much, YB.
Thank you. That's wonderful. And of course, the women of Permatang Pauh are also direct recipients, and you know, for all the support that WCC has rendered. I think it's also great that you guys have collaborated with Dr. Amar, who is also a favorite among the MPs, since it's providing timely and evidence-based feedback. So one of the key things I think we should, give a round of applause to all our panelists, because we're talking about evidence-based, right? And letting data kind of lead the policy changes that we want to introduce. Now, of course, Dr. Lai, you cannot escape. You have to answer a very key question, and I hope we can extrapolate further from your time and, of course, in your department. When people ask, can there be substantive progress on ensuring bodily autonomy and ending violence against women if there isn't 30% female representation in government? So what are your thoughts, and what do you think that needs to be done at the policy level to address this issue?
I think when it comes to representation in Parliament, if you look at it right, the percentages of female parliamentarians, the numbers has not been very encouraging. And if you look at international level, they actually prescribe for a minimum of 30%. But in Malaysia, I think the highest we ever reached is actually around 20%. Right, that's the highest. But before that, it was like hovering 10% or even less. So of course, if you look at cases in other countries, when there are more women parliamentarians, we find that they're also more responsive to gender-based violence issues, or in terms of the needs, of women, in terms of the needs of the family and whatnot, because they have to do, or they have to deal with the day-to-day grind issues pertaining to the family. So that's very important, yeah? And of course, also, as women, we do experience the violence. I'm sure if you ask any women, when I go to a classroom, or I've done training on gender-based violence, you ask them, who have actually experienced sexual harassment, you find that majority will actually put their hands up, yeah? So it's actually a fact of life, and because of that, I think partly, women would also be, tend to be more supportive. But on the other hand, we find that we also need to change the culture in society, right? Based on the shocking, presentation. It's shocking in a way, but in a way I would say it's not to me, because also we have been teaching students, and from time to time, we actually have students who shared in class of what they have experienced at home, and sometimes also they've experienced it for a number of years without realizing it's sexual abuse. It's actually sexual harassment. Yeah. It's like, because we talk about it in the classroom, because we create a safe environment, then finally they're saying, oh, dear me, I didn't realize that that's what I've been going through. right? So in a sense, I think it means that we actually need to change that kind of culture. And when we talk about bodily autonomy and the periodic spot check that was mentioned, I think it's actually so unacceptable, because we're also sending a message to girls, hey girls, you cannot be trusted. That's why we have to check you. What are we telling our girls? Right? I think at the basic level, how is it going to build the self-esteem of a girl? It's going to destroy it.
It's like you're at fault, that you're the problem.
Yes, that's right. Yeah, it's right. Yeah, I'm like, that's ridiculous, you know. It shouldn't happen in any society. And I think Malaysia needs to take concrete steps to stop it, immediately stop it, right? And also, when we talk about a culture in terms of respecting women's and girls' bodily autonomy, I think we need to start at the school level. We need to have actually lessons, you know, create lessons surrounding that, and also lessons on gender equality and whatnot, right? I think the civil society is doing a brilliant job, a great work, but I think we need to have a national policy to address that, because we find that it's actually, you know, happening in a very pervasive manner based on the statistic that's been collected. So I think we need to address it at the school level so that girls are also aware and also can protect themselves, right? When they are being, when their bodily autonomy is being breached, is being violated, right? Rather than, because if not, then we'll create a very permissive culture, as if saying it's okay, you know, we shouldn't trust girls, therefore we have to do the periodic spot check, right? And also, I think the Ain Husniza case, you all have, you know, you have a presentation this morning, right? Why do we have to tolerate rape jokes? Yeah, why is it okay? From whose perspective?
Yeah.
Yeah, so I think we need the curriculum to address all these issues so that children, the presentation, by WCC, right? You find that 70% of the cases involve children. Yeah? So I think it's very important for us also to address those issues and, you know, include sex education as well, so that children can protect themselves and know that, hey, that's not, you know, that's not right. Yeah? And I'm saying in our national school system, so that it's all covered. And I'm sure civil society can actually provide very good input in that, because they've also created materials and whatnot, yeah?
So Dr. Lai, I think it's not just what you're suggesting is very crucial, to include it as part of a first aid psychological toolkit for students, right? But at the same time, I think I should be bringing it to Parliament as well, to educate all members of Parliament, because, you know, we're talking about lifelong learning, and, you know, you can't assume that every member of Parliament, whether female or male, understand. I mean, I'm learning so much today as well, and I think it's quite crucial for gender studies to be something that we adopt as part of the, you know, upgraded psyche to improve the way things are conducted in our Dewan Rakyat.
Yeah.
Yeah, hopefully.
I think YB Nurul Izzah, I think you actually highlighted a very important point, that we don't assume that, you know, just because we are female, we will immediately support it, right?
Of course.
Because it also depends on how we have been brought up, how we have been socialized, yeah? Though, of course, the tendency, if there are more women parliamentarians, certain issues would actually get more attention is because of their own, you know, they also experience it, you know, as women, you understand it, because you also, you know, you also have to face that, right?
Sure.
Just as I think in parliaments, we have also seen how female parliamentarians have also been attacked and whatnot, you know.
But they can also themselves, you know,
right.
be part of the problem. So it's not going to be, we can't generalize here.
Yes, of course. Yeah, but I'm also very amazed at how all of you have also stood up, right? Like,
Thank you.
Yeah, female parliamentarians have also stood up against it, yeah? So I think that's amazing. But I think also increasingly there's a need for men also to stand up and speak up on these issues. Yeah, because it's not just a women's issue, you know, men, you have your children.
It's a joint struggle.
Yes, that's right. It's a struggle together, yeah.
Thank you. I think this is a nice segue for both Sumitra as well as Nisha to weigh in on the sexual harassment bill, because one of the key things that we have found right on top of our table is the draft of the bill. It hasn't been read, you know, as part of the second or third reading, but at least it's there after being, you know, waiting for it since 2020. So let everyone hear your thoughts on this matter, and maybe we'll start with Nisha first.
Okay, thank you, YB. So as most of you may or may not have known, the sexual harassment bill was tabled on the 15th of December. There wasn't much hoo-ha about it. It suddenly just appeared on the list, and there was a tabling. Yeah, right. Yeah. So you're hearing it from the person who was actually at Parliament.
The moderator today.
And so they read it out, and of course, the copy of the bill is actually available on the website of the Parliament. So we encourage everybody to go and have a look at the bill and see whether it actually answers and responds to the needs of society. I mean, we've been fighting for this bill for over 20 years. It's crazy.
Can you repeat that, please, in case no one hears you?
Sorry?
Can you repeat how many years?
We've been fighting for this bill for at least 20 years. I suspect it's been close to 30 years. And actually, Karen here at WCC can probably also tell you that the person who actually...
So many generations of us, YB and Nisha.
Some of you in this room were not even born yet.
Our aunties, semua lah, belum pas lagi.
Yeah, that's right. And so in a way, it is a form of a certain amount of victory that it was tabled. But unfortunately, what we want to see is a sexual harassment bill that is holistic and that is comprehensive and that responds to the needs of society and the needs and the inputs that both civil society and also members of the public have actually put into the bill over the years. Nice. So we're not babies when it comes to the sexual harassment bill. We are actually, people who are experts. And experts are not just civil
experts.
Yes. And in a good way, yes. So people like Sumitra and Dr. Lai and even YB, people, there are quite a few people in this room have actually been quite involved in making sure that the bill that was drafted out is actually a bill that we need. So I want to just point out and say, and maybe Sumitra and Dr. Lai can also add on, that one of the things that we noticed in the bill was that it did not really address organizational duty of care. So one of the things that we all really wanted was that for organizations, especially in the private sector, and now also in the public sector, looking at the period spot checks and sexual harassment in schools, right, that they need to actually have a duty of care when it comes to addressing and handling issues of sexual harassment in the private and public sphere. And one thing I want to point out, really, one of the reasons why the Ain Husniza case was just not handled properly. One of the reasons why the period spot checks were just not handled properly is people do not know how to handle sexual harassment cases. I bet you with the Ain Husniza case, it was such a big shocker to the Ministry of Education. Yeah. The minister himself did not even respond until after a few days because he probably just didn't know what to say and how to deal with it. And in a way, I actually felt for him because it was not an easy case. But that's where you come and you reach out to experts like people in the civil society and also members of parliament themselves who can all support. At the end of the day, what happened to her was wrong. Clear cut, whether you have a bill or you don't have a bill, what happened to her was wrong. Imagine a teacher telling a school room full of pupils that if you want to rape a girl, make sure that she's above 18. Yeah. Imagine that happening to your own kids in school.
As an
and
enabler,
some of you may have kids. A lot of young people here, I don't know whether you have kids, but you will eventually have children, right? Yeah. And imagine a teacher, somebody that you trust and somebody that you look up to, especially in Malaysian culture, teachers are like a big deal for us, right? They're still a big deal for us. Yeah. Imagine that happening. So that's why it's so important for our current sexual harassment bill to actually have this organizational duty of care. And that is one thing that is a huge gap in the current bill.
So I probably would ask Sumitra as well to maybe suggest some of the key additions, because members of parliament can bring up some amendments as deemed acceptable by the ministry, but at least we can push, because it's important when you talk about organizational duty of care. Similarly, during the pandemic, you talk about workplace related clusters, factory related clusters. Who do you blame? The individual? If the individual is wearing the mask, but they're in a confined space, they're not being given this, that level of ability to work safely, clearly something's wrong with the organization. So similarly, it can be applied throughout the spectrum of care and problems. So Sumitra, please, if you were to suggest some changes, and you're speaking to the government right now, what would be the key amendments that you think the bill could utilize to make it far more comprehensive and impactful?
Okay, so with pleasure, wifey Lisa. So before that, I just want to say that I love that phrase that you use, upgraded psyche. I think that's so important. I think we all need to upgrade our psyches. And through lifelong learning and education, I think that's super important. So yes, with pleasure. How can the bill be stronger?
Yeah.
Well, there are three main things, right? So, and all of them hinge on the need for the bill to be survivor-centric. So, three of us here spent weekends cooped up in a hotel together with KPWKM until 12 until 12 midnight working on the bill. All right. So yes, so there are three things. So first of all, we need a comprehensive sexual harassment definition, and this needs to cover sexual harassment in all of its forms and contexts, including online sexual harassment. Okay. So we actually, civil society groups, women's groups, we put together a definition. And that definition is, sexual harassment means any unwanted conduct of a sexual nature in any form, including verbal, non-verbal, visual, gestural, or physical against another person, which reasonably causes offense, humiliation, threat to the person's well-being, or creates an intimidating, offensive, or hostile environment. Okay? We need that comprehensive definition. Secondly, we need to have the tribunal. Yes, there is the tribunal in the draft. Great. But the tribunal needs to be meaningful. It needs to receive and investigate sexual harassment complaints in a manner that is not only fast and affordable, but also protects survivors' privacy, provides protection against victimization, and addresses survivors' needs via provision of a range of remedies, right? This includes compensation, rehabilitation, and apology. And then the third thing is, as Nisha had mentioned earlier, that is explicitly mandate a commitment by organizations, including educational institutions, in the public and private sector, to prevent and address cases of sexual harassment. As well, create organizational awareness via anti-sexual harassment policies, trainings, and effective redress mechanisms. I mean, Eureka!
Yeah.
It's not rocket science.
And
For transformational equality, you need to have substantive change, structural change, cultural change. This is what you need. You can't go halfway. You need to go all the way, because all the evidence that we have been talking about today shows us how critical it is to address this.
So the proof of the pudding is in the substantive portions of the bill. And I hope, this are the key recommendations that we'll be bringing forward. Our Bifuzia was also here, thanks to the UNFPA. And I believe we also need to bring up this message to the AGC, because it will be them scrubbing the last bit of the bill. Now, with all this being mentioned, I think it's also important perhaps to hear what the WCC has planned with regards to why they feel that top-up women-only additional seats for women perspectives align with not just making sure that sexual harassment bills, the issues are understood, but bodily autonomy and rights and choices for women and girls, as well as boys, take place through a policy-making angle. So, the burden is huge on women, and I think it should be also shared with men. So whoever it may be that's chosen to be part of the top-up additional seats, especially when they are specifically allocated for women, also must come with candidates who display a great understanding and depth on these issues to better protect our women and girls. Please, Karen, over to you.
Thank you very much, YB. First of all, let me tell you a little bit about TOAS, or Top Up Women Only Additional Seats. TOAS is an initiative of the Penang state government that was mooted since last year to basically top up women-only additional seats. Yeah, so it's basically a means of increasing the number of women state assembly representatives, or ADUN, in the House through nomination, yeah, and adding them on until they reach a minimum 30%. They will hold non-constituency seats, meaning they don't have a specific kawasan, geographically speaking, within the state, but instead be working on issue-based portfolios. Now, why is it significant? Yeah, it is true, I think, that when you have increased women's representation in decision-making, whether it's at the political level, corporate sector level, public sector, and so forth, you will see a heightened level of attention to women and gender issues. So by the virtue of that alone, you know, I think it's fairly safe to say that there will be greater attention to issues of sexual and gender-based violence, which disproportionately affect women and children. Yeah. So that said, I want to address the idea that sexual harassment or even gender-based violence is a women's issue. It's not a women's issue. It's a societal issue. Okay, women and men should be equally concerned about this, particularly when you talk about sexual violence. Our children, our next generation are at stake. You know, bodily autonomy is an issue that I know disproportionately affects women and girls, but it also affects men and boys, yeah, to a lesser degree, particularly boy children who are vulnerable because of their age. So we need to debunk this idea that we push all this stuff to women leaders and women representatives alone. And we seriously need to engage men as well in the conversation as allies to take this forward. But yes, in short, YB, the increase in women's representation, it is hoped, will highlight greater attention and also interventions on this issue, particularly if Penang is able to take this on as a specific portfolio with more concentrated resources. I'll stop there for now.
Thank you, Karen. You know, because when you talk about backlash in the presentation mentioned earlier, I think both Nisha as well as Sumitra alluded to it. We want society to also embrace, because this is a joint struggle, and it requires every segment of society, the whole of society approach to provide an ecosystem that's safe for both our boys and girls. And that's why I wanted just to share a little bit. You know, you guys run, especially Sumitra, you run a shelter, right, for women who are trying to seek protection. Yet, in some instances, somehow the information of where they are get leaked, and the abuser then finds themselves right in front of your doorstep at the center or at the shelter. So how important is it for us to inform everybody, you know, from the point of reporting until eventually, inshallah, hopefully, successful conviction? There's an entire spectrum of care that requires the support from the police force, from the welfare workers, from people who actually, usual public, members of the public, to understand, hey, we're in this together, because we're trying to protect innocence. And if we don't do it together, and we feel that you want to, I don't know, maybe you feel sympathetic towards the abuser. So please tackle this bit. Maybe you can share a little bit what needs to be done to ensure a successful conviction takes place and the victims, can survive and thrive.
Yeah. So, the most important thing is, one of the very important things is access to justice. So when a woman is a survivor of domestic violence, or even a man for that, although the percentage is much, much lower, but it still occurs. And actually, interestingly, the perpetrator is still male. So when you have a male victim, it's either, an elderly relative or a father or so forth. But in any event, access to justice is critical. And our data also shows that women will go to the police. They will go to the police, right? But that is the first barrier, and that is the first challenge. And because that is where all of the public attitudes that we have spoken about, where there's victim blaming, where there's no real recognition that this is actually a crime and not a family matter and so forth. These are persistent and they continue, right? So that is the first barrier, being turned away, report not being taken, and being scolded, being told next time don't make your husband angry.
Wow.
Although having said that, there are some police stations, especially in urban areas, and very much always depending on who's the chief of police there.
Sure.
There is that, sometimes you see that change. So even if it's a cover report, you will interview the survivor and you will take information from her, because next time it's going to be important. The next report she makes, it's going to bolster. So, while we still have that kind of police action, there is a lot of demonstration of a lack of knowledge and a lack of capacity and so forth, right? And then you're right, that feeds into a whole range of different actions, including when an NGO like WAO tries to keep a survivor safe, right?
Yeah.
So those victim or violence endorsing attitudes, the victim blaming, although the child has been severely abused by the father, but you know what? The father has a right to have his son back. It's like, no, there's a protection order,
You breach
but
the right
no.
when you've hurt the child.
So there's a lot. It's not just societal attitudes that need to change. It's also the attitudes by those people who are mandated by law to provide support and protection to survivors of domestic violence. Their attitudes also need to change for there to actually be change.
Thank you.
So,
Thank you, Sumitra. And it goes back to our earlier discussion. Dr. Lai, you took even a course on education, on making sure that you take into account the minds of your students. We're dealing with a lot of educating here, right? Including policymakers and so on and so forth. But how would you suggest, what are the key concrete steps that we can sort of provide to ensure kids in school, teachers in school have what it takes to kind of prepare the psychological, social safety net in the event that they face a lot of challenges, not just about abuse per se or harassment, but just general knowing your rights, understanding even as you empathize, there's boundaries that you need to preserve. So I think it's important to introduce when they're young, right? And this also includes like a sort of a systemic approach. So perhaps you could lend your thoughts.
YB, I think it's very important that we have a systemic approach, and the best place to start is, of course, when they are young. I'm sure you have heard of the Malay idiom, right? Melentuk ahau biarlah dari rebungnya kan, yeah? So, in that sense, I think we need to start it during the school, at the school level itself, as I've actually highlighted earlier on. But I think when it comes to addressing like the law enforcers and whatnot, those who receive such cases, I think the women's movement, also because I've been active in women's movement as well, they actually have also come out with, gender-sensitive training, of police, of law enforcers, of those who deal with cases of sexual harassment or rape, right? So I think that needs to be done periodically, because it's like, personnel change from time to time, even for university and whatnot, right? Speaking on, in terms of the Universiti Malaya, where I'm from, we also, in terms of lobbying, speaking to the management about it, I'm proud to say that we have actually revised our sexual harassment policy, and it's actually a very much improved version, though of course there are still shortcomings, but it's very much an improved version. And one of it is actually that I've actually been lobbying is also to include, it's not just about having the policy or law, because like when I was doing a research on gender equality and inequality that includes sexual harassment for the Association of Women's Lawyers, WAO is also part of the, was also commissioned by WA and Suhakam. One of the things that we find is that, you can have a code of conduct to address sexual harassment, but those who are working, those who are in the profession, does not know about it. So what's the point of having a code of conduct if nobody knows about it, right? So it's also publicity, right? And besides publicity, it's also those who are receiving and handling the cases. So we actually have to focus. It's also, I mean, I'm glad that Sumitra has actually, and Nisha have actually pointed out some of the weaknesses or shortcoming in the anti-sexual harassment bill.
Important pivotal bill.
Yeah, it's very important. Yeah, but in addition to that, right, you also need to train people.
Yes.
So that they have a gender-sensitized perspective. Say if a sexual harassment survivor comes, you don't ask, what were you wearing? What were you doing? You know, it's like putting the blame is, you know, it's actually blaming the victim. So rather than saying that, you say, oh, what happened? You know, please describe to me what happened, right? Which is more neutral, yeah? Rather than saying, what did you wear? Why did you go out with him? You know, things like that, yeah? So I think it's actually very important for the training also to be availed. But besides that, I think what is important is also for monitoring, for organizational monitoring, right? An organization can actually easily do a survey, right, on sexual harassment cases, prevalence, its prevalence, and of course also when a survivor reports a sexual harassment cases, whether they actually receive any backlashes. I think that's very important also to take into account, because as it is, we know that it's very hard for sexual harassment survivor or even rape victims, right? We all know that. I mean, you all have shared, you know, because in our culture, it's like, even though they are the ones who are being sexually violated, they are not the perpetrator, but they are the one who feel shame.
Of course.
Right? They are the one who feel
imposed
guilty.
on by society.
Yes, yeah, because of how it's being normalized for society.
Thank you, Lai. So in the last 5 minutes, I wanted Nisha to actually also add on, sorry, moderator must control time. I'm a cognizant. When I would love to hear more, because honestly, this has been one of the most engaging conversations that, you know, are affecting lives, right? So whatever we're talking about, bodily autonomy, is actually dealing with real life problems that people face on a day-to-day basis. So Nisha, can you just share with us, just now you mentioned some of the backlash that took place. Now that whole movement makes schools a better place. How do you think it has impacted you know, the scenario, how people's perception has changed, and what do you think should be the concrete steps that we should take in terms of moving this agenda forward? Because I'm still hopeful, because the silver lining light in the way people saw child marriages.
Yes, that's actually true. So usually when it comes to children, people tend to move a little bit faster, which is fantastic. You know, that's great. So with the safe make school a safe space movement, right? We saw a lot of people on social media supporting us. So generally we get a lot of support on social media. We also get a lot of support from parents. There were one or two things that we did that perhaps parents didn't like when it was the school walkout day, because you know, in Malaysia, parents still want their kids to be in school studying and getting their A's,
my children
right?
was asking about the 100% policy that I imposed on them. But
yes, that's right. That's right. But what we noticed is actually the main backlash came from the authorities. So the National Union of Teachers were very, very upset that we were blaming teachers for sexual harassment. But what they don't understand is, of course, it's not all teachers. We never say that. It's always a percentage of teachers that are sexually harassing or talking about, you know, or imposing rape culture upon their students. And what they don't understand is how this actually affects, you may have one teacher, but you have 40 people in class. How does this affect that 40 children in class? The second thing that I think we wanted to bring up was the fact that how the Ministry of Education actually did not react as fast as we hoped that they would. And that was really quite disappointing to us. We wrote to Minister Razzie Jidin a couple of times. We did reach out, however, to some agencies within the Ministry of Education. And what's interesting to note is a lot of them actually agree with us.
Nice.
They recognize the fact that
that's important.
Yes, civil servants actually do recognize that, because their kids are in school as well, right? Yeah. So they recognize the fact that this was an issue that national schools currently could not handle, and they recognize that counselors and teachers needed to actually get specific special training on how to recognize what sexual harassment is, what rape culture is, how to handle it, how to teach the kids to handle it, right? They also recognize the fact that we probably need to institutionalize this in teachers' trainings, colleges, because guess what? Sexual harassment also happens among teachers. So there were even 1 or 2 complaints that came from teachers because sexual harassment is an issue, as Karen so really properly put it, it's a societal issue. It's not an issue that just happens to school kids or women, or it happens to all of us. And when it happens to your kids, it affects the whole family. So anyway, the Ministry of Education did open a little bit of doors for us to have conversations with them. But we need more robust policies. We need policies within schools where they have a proper complaints mechanism system that protects whistleblower, which is why the sexual harassment bill is so important to have that organizational.
But not just protecting the whistleblower, but even the perpetrator. It's not just enough to move them to another department, another school.
Absolutely, yes.
That
hurt
doesn't
people,
solve the
hurt
problem. Others. You have to either rehabilitate or manage. Yes, Karen, you put up your hand.
YB, may I
Yes.
chime in a little bit my thoughts on bodily autonomy?
Last 2 minutes, yes.
Last 2 minutes. Okay, bodily autonomy is essentially the right of a woman or girl to decide how and what she wants to do with her own body, right? And so far we've been talking a lot about children, but I think bodily autonomy applies to women and girls of all ages, whether it's a girl child or an elderly woman, all the way through. And make no mistake about it, there's this Peter Drucker quote that I love. It's called, "Culture eats strategy for breakfast." No matter how good your laws, your systems, your policies, your mechanisms, if you have a cultural mindset that is so misogynistic, victim blaming, and think that women have no right over their own bodies, you are fighting an uphill battle of the psyche. All right, essentially, you are waging a cultural war, and that's a generational thing to change. Every day, my social media stream is filled with articles, from popular media, moral policing women's attire, okay, talking about what they can or cannot wear and scrutinizing every possible inch, saying, oh, she shouldn't be dressed like that because, she's a mother, or she's so-and-so, or she's sexy and all that. And yesterday I came across a seriously disturbing article that talked about how prepubescent boys get sexually stimulated and telling mothers not to walk around overexposed in front of their sons in case they stimulate their sons sexually. Instead of encouraging a healthy conversation about sexuality within the family, mothers are told to cover up. Implicitly, the messages are that women's bodies are shameful, are sexual, are meant to be controlled, even when it is a mother vis-a-vis a son. So we're dealing with serious cultural issues here. So even if we educate our young, if they come out into this type of world, what kind of future do they hope to inherit? So I don't need to end this conversation on a bleak note. I just want to highlight the extent,
I think
the severity,
it's brilliant
and the depth of the problem.
Absolutely.
Yeah,
I think before we try to tackle the issues, it's important to, eyes wide open. The pandemic also has showcased the vulnerabilities that have long existed, the inequities that have long existed. So there's no use with, sweeping things under the carpet. Right? We have to address this. It's happening. I mean, I've been, most of the experiences you mentioned, been there, done that, right? So that's why we have to
As a woman
together.
in politics, YB, I'm sure you are up for, people think you're up for grabs.
For sure. And that's why we have to really come together and address these issues and understand the legal framework and the ongoing challenges that's happening right, in the center of the community. So thank you so much to everyone, especially civil society. You guys really have done so much. You have preserved this legacy of knowledge and awareness and realization and empowerment. And I think congratulations to UNFPA, because you know who the right people should be chosen as panelists. And I do hope that you come and continue to educate and create more awareness amongst legislators as well as the entire spectrum of society. Thank you. And thank you to those of you who are listening. Make sure you tune in again. Sorry, we got no more time. Wassalamualaikum.
Can I just ask for 1 second very quickly?
Okay.
I just want to correct. Thank you for the fine moderating, for introducing us. I just need a small correction that I'm a senior lecturer, but no longer a coordinator because I'm, I'm on sabbatical. I don't want the coordinator to see that. And, yes, that's right. Just to correction. Yeah. Okay. Thank you.
Thank you so much, YB and fellow panelists, and also UNFPA.
Thank you very much to our fellow panelists, also YB Izzah. That was a very insightful and very engaging conversation. So again, ladies and gentlemen, to those of you who are watching, thank you for still being with us right here at MWGF 2021. Again, our hashtag are MWGF 2021, hashtag badanku milikku, hashtag my body is my own. Keep the conversation going in the comment section. Follow the hashtag and post your thoughts and screenshot using the hashtag, and also tag United Nations Malaysia and UNFPA Malaysia on your social media. Now, ladies and gentlemen, we shall move on to the third keynote of the day, bodily autonomy and the role of media in promoting gender equality here in Malaysia. Now, our keynote speaker for this session is Dr. Melissa Young. Now, Dr. Melissa is an assistant professor at the School of English, University of Nottingham, Malaysia. Her research investigates how language used in media and other contexts normalizes and reinforces enduring inequalities at the intersection of gender, sexuality, employment, family care, class, and migration. A key aspect of her work involves critically examining language that pays lip service to women's empowerment while upholding the status quo. She's also an author of the book Professional Discourses, Gender and Identity in Women's Media, published by Palgrave, and other academic contributions to journals and edited books as well. Now, ladies and gentlemen, it is my honor to pass the mic to Dr. Melissa.
Thanks, Zoe, for the introduction, and thank you to UNFPA and the wonderful team behind the Malaysia Women and Girls Forum for the opportunity to speak on this important topic this afternoon. If we look through newspaper headlines, magazine covers, Instagram posts by media organizations, and advertisements and YouTube videos targeted at women and girls, we will quickly notice that there is a growing volume of messages telling girls and women to be bold, to be empowered, to maintain bodily autonomy. And it can seem like the sexism in the media is no longer a serious issue in the country. Sure, there are the occasional quote-unquote slip-ups, but overall it might appear as if we have a feminist media. We do not. Sexism still exists in the Malaysian media. However, because the social status of women on the whole has improved, and because of feminist pressure to end sexism, overt or direct sexism is now increasingly stigmatized within media discourse. In past years, we have seen how feminists and male allies will call out discriminatory language and images and hold those responsible to account. This can be bad for business. As a result, a more indirect sexism has developed in the Malaysian media landscape, which manages to keep sexist ideas alive while at the same time denying responsibility for it. Indirect sexism can appear benevolent on the surface, such as media comments on women's physical appearance that are coded as quote-unquote compliments. It is important to recognize that compliments have a range of functions. They can be used to do many different things, and power can be relevant. To fully understand what is being communicated, we have to go beyond the literal meanings of the words and consider the social context surrounding the language use. The media's appraisals of women do not occur in a neutral context. We live in a society that is gender unequal. Ideals of femininity are still linked to deference to men and men are still often regarded as sexual subjects and women as sexual objects. Thus, these complements can serve to reinforce the view of women as fair game in the public sphere, and women's bodies as public property, to be commented upon and assessed in ways that men's are not. It sends the message that women's bodies exist to please others. This does not create empowering media spaces for women. Further, women as a group still have less political, economic, and cultural power compared to men. When professional women are reduced to objects of gaze, this trivializes them in contrast to their male counterparts and contributes to the invisible barriers that keep women from participating in their fields on equal terms. Indirect sexism is sexism with an alibi, a wink, and a smile. It can be made to look more benign through seemingly playful humor and innuendo. Often in cases of sexual humor in the media, even when it's very apparent that women are treated as objects, we are expected to assume that we shouldn't take such representation seriously because of the linguistic and visual cues that indicate excessiveness. Because the sexism is so overstated, we are supposed to interpret it ironically as a harmless joke. But such jokes dehumanize women. They encourage society to withhold recognition from women as human beings with human feelings. And this can negatively impact women's bodily autonomy. Of course, I'm not saying that sexual humor will inevitably lead to domestic or sexual violence. But as the linguist Deborah Cameron argues, when you objectify and dehumanize a class of people, it becomes easier to mistreat them without guilt. Recently, the actor Fauzi Nawawi came under fire for making a rape joke on a chat show. In the clip that went viral, the actor shares how much he enjoyed filming a rape scene for the movie Anak Halal. He is the alpha male who takes the spotlight in the all-men group, while the hosts urge him on with questions and affiliative responses and greet his remarks with appreciative laughter. After facing some backlash, the actor released an apology. And I use this term very loosely, as it was quite clear that he was trying to excuse their talk as harmless banter and boys being boys. But is it really harmless? Let's unpack this. Such sexual banter is male bonding talk. By divulging private details about himself, the actor positions the other man as trusted confidants. Although in his apology, he protests that he had made an unfortunate slip of the tongue, we could argue that the transgressiveness of his talk was not accidental, but a deliberate part of that bonding process. The sharing of his transgressive desire is a token of trust and an invitation to the hearers to reciprocate by offering a token of approval, such as laughter, or a similar transgressive comment. So when Fauzi Nawawi argues that he had no intention to embarrass Raja Farah, this is likely true. The motivation behind the offensive humor was likely to strengthen the bonds of solidarity among male peers, prove their manhood, and impress male friends. The woman involved was a mere means to that end. But this doesn't mean that the male banter isn't damaging to women. Misogynist talk is not an individual vice. Many men around the country and around the world have participated in similar conversations. It is a ritualized social practice that reinforces heterosexist norms of female objectification and contributes to the maintenance of structural gender inequality. According to the anthropologist Peggy Resende, rape culture arises when men have strong fraternal loyalties to each other and at the same time dehumanize women. Male banter promotes both these conditions. Therefore, Astro Warner, by airing the segment not once but twice and adding what sounds like canned laughter in the background, made what Carol Pateman termed fraternal patriarchy, or the rule of the brothers, seem light-hearted and benign, and in the process promoted the toxic masculine behavior that enables rape culture to flourish. A further problem is that Fauzi Nawawi was not the only one to linguistically downgrade the seriousness of the man's behavior. Some media stories describe the interaction as locker room talk, crude language, and distasteful remarks, as if the issue was the vulgarity of the words used. In some cases, the actor's behavior is constituted as a harm to just an individual woman, Raja Farah, rather than a group harm, a harm to all women. Reframing the misogynist talk in euphemistic language can prevent the rape culture perpetuated by such media practices from being addressed and allow it to continue. Sexism in the Malaysian media can also be perpetuated through normative and socially accepted discourses, which can make the sexism even more difficult to identify and critique. One example of how sexism subtly pervades media practices is the way that issues around gender roles, paid work, and family care have been reported during the pandemic. One dominant discourse circulating within the news articles is mother as main parent / part-time father, which positions mothers as primary caregivers and fathers in a supporting role. Consistent with cultural assumptions that mothers are the natural and biologically superior caregiver, there are much fewer references to husbands and fathers as caregivers. Sometimes, even when the men are mentioned, they are not even portrayed as the secondary parent, but as another family member that the women need to care for. It is not only women and men's caregiving identities that are constituted asymmetrically. The same can be said about their professional identities. Often, while both women and men are represented as engaging in the labor market, women are portrayed as workers and men as family breadwinners. To quote Potuchek, breadwinning differs from being a worker, as it involves not only paid employment, but also the day-to-day obligation to earn money for the financial support of a family. The breadwinner has a duty to work, and leaving the labor force even temporarily is not an option. As the Khazanah Research Institute noted, state policies in recent decades appear to promote a gradual shift in the approach to care provision from the traditional male breadwinner ideal to the universal breadwinner family. However, in the media, male breadwinner norms persist. Employed mothers are positioned as professionals but not breadwinners. Their careers are often framed as contingent upon childcare support and family responsibilities. As the linguist Sherry Kendall noted, such a perspective endangers women's paid employment, since if it's viewed as contingent and supplemental, it is likely to be reconsidered. This can have a negative impact on women's bodily autonomy. For example, women who lack economic independence and stability are more likely to stay in an abusive relationship. The problem with the dominance of the mother as main parent and mother as worker discourses in the media is that although they may position women in ways that reflect current understandings of work and family roles in Malaysia, and what is often the case in practice, they do not promote more egalitarian ideals for women and men. By putting women at the epicenter of caregiving and normalizing expectations for men to be the primary providers, the discourses entrench some of the very issues that are hindering women's equal participation in the Malaysian workforce. However, while such articles are indirectly sexist in the way that they represent gender roles, there's nothing overtly sexist in them. And as researchers have argued, covert messages can do more to sustain gender ideologies than explicit messages. Not everyone critically interrogates and unpicks what they read or hear. Of course, as media consumers, we do not always passively accept the discourses and ideologies conveyed. But given that sexist perspectives are established, accessible, and genuinely accepted by society, they are easier to draw on compared to alternative meanings that problematize conventional notions of gender. And when certain representations are reinforced over and over again across multiple platforms without much alternatives, these portrayals can become normalized and taken for granted. The media must recognize that the way they talk about women and men, girls and boys, and their roles, responsibilities, and behaviors can feed pre-existing stereotypes and damaging sexist ideas. For example, in the news report about domestic violence at the bottom of this slide, the newspaper quotes the Deputy Minister of the Women's Ministry without comment. As a result, the newspaper's voice merges with hers, with the effect of implicitly endorsing her views. This in turn can reinforce the common belief in Malaysian society that domestic violence is a normal stress reaction. To transform how society thinks about gender roles and gender relations, the media must improve how they represent cultural ideals of masculinity and femininity. But to do this, the stick of regulation is insufficient. Real lasting change will only come with a genuine will to be better, as well as systematic changes in the culture and leadership within the industry. The media must turn the mirror on themselves and engage in critical self-scrutiny. Sexist attitudes are pervasive and we all harbor biases, whether consciously or not. Therefore, gender training for media professionals, journalists, and editors can help them to critically reflect on the gender prejudices that they have taken for granted as normal and common sense, as well as how these come true in their media messages and in turn sustains gender disparities and negatively impacts women's bodily autonomy. Part of this includes not only developing zero tolerance for overtly sexist language and sexist humor, but just as importantly, examining the way some words are not used in the media's discourse. They need to check themselves for linguistic downgrading and ask if their language choices silence or confront structural issues. If we want to bring about social change, we need to stop using words that cloak the reality of patriarchy and misogyny in vagueness and euphemism. When misogynist talk and rape jokes is reduced to crude language and locker room talk, as we saw earlier, the repetition of these formulas can establish them as the truth. Gender training can also provide the media with the skills and knowledge to analyze facts and issues from a gender lens. Too often, news reports on gender-related issues are not connected to the wider systemic gender inequality that affects women. Events are reported as isolated problems, and the interrelationships between these incidents and patriarchal norms, toxic masculinity, and power are not made visible. The media plays an important role in bringing to light how seemingly separate experiences emanate from the same systems of privilege and oppression, and that these systems must change. Finally, as noted earlier, the rhetoric of women's empowerment has become prominent in media discourse. However, as we have seen, these are often superficial changes that conflict with the sexist messages that the media outlets distribute. The media needs to pay attention to how language that is empowering and uplifting on the surface could be used to entrench gender issues. For example, it needs to reevaluate how their deployment of words such as confidence, empowerment, diversity, and inclusion detracts attention from self-scrutiny regarding the country's gender issues, and accordingly from the possibility of real change. When the media appropriates feminist language and hollows out the political meanings, they effectively silence structural inequalities. It is important for the language of empowerment to be reclaimed to serve the cause of social justice and change, and that the media repoliticizes what has been depoliticized. To close my talk, I would like to call on the media to be more than mirrors of society. They have the opportunity to be actors of positive change. The stories that they tell about women, men, girls, and boys all matter, as this can offer alternative visions of gender roles and relations. Acts of resistance through the agency of the media will take commitment, but they are crucial and necessary for women's empowerment. Thank you.
Thank you, Dr. Melissa. That was a real eye-opener about the media's role when it comes to women's rights. Now, ladies and gentlemen, it is time for a short Q&A with Dr. Melissa, and I'm honored to welcome back Ms. Tamina, the MWGF Head of Secretariat, to moderate the discussion.
Thank you for that, Zoe. And of course, welcome back. So now we're on to the moderated discussion session with Dr. Melissa, who just gave us a fantastic presentation on why it's so essential to highlight the impact journalism and media actually has on gender equality and, of course, related to women and girls' bodily autonomy. Dr. Melissa, I think that it was really eye-opening the way that you actually framed how often Malaysian media offends and actually reinforces rather than helps break down these hierarchical stereotypes. I wanted to ask you now, so moving towards a more positive outlook, tell me about what, in your perspective, constitutes gender progressive journalism and how that can be enabled better in the Malaysian media landscape.
So for me, gender progressive journalism would be journalism that doesn't just feed information to us, but also analyzes trends and offers suggestions and solutions to us. I teach discourse analysis and gender, language, and sexuality in the university. And very often my students would analyze media discourse as part of their research projects. And one of the things that they often tell me is that when they look at how different newspapers report on the same event, they all say the same thing. There is pretty much no difference across the newspapers. They are quoting the same people. And also they tell me that the newspapers don't say much. There isn't that much content. The newspapers would quote certain figures, but they wouldn't comment. They wouldn't actually have a stance on what they think about the particular news event. So I think we need journalism that is brave enough to offer counter discourses that run counter to common sense, that effectively tries to disrupt the status quo in this country, which discusses women's issues in a more politicized way, that tries to connect the dots more for the people.
Yeah, absolutely. I think you make such great points there, Dr. Melissa. Now let's speak specifically about the fact in which so-called women's issues only, despite them being wider societal issues, like domestic violence, have been covered during the pandemic. What is missing from the narrative with regards to your expert opinion?
Okay, so when I looked at how the newspapers report violence against women, what I noticed is that they focus a lot on the victim and not much on the perpetrator. They would introduce the perpetrator perhaps in the lead paragraph or the second paragraph, and then at the end again to just highlight that he has been arrested. But the rest of the article would be focusing on the victim. And that's a huge issue because that frames sexual violence, rape, domestic violence as a woman's issue, what is missing from that story is the man. So the newspapers have excluded men from the cause as well as the solution. And also because they focus so much on the victims, there's a potential to actually lead to victim blaming, because what did she do? What did she not do? When did she do it? Did she wait too late?
Indeed, and especially the passive voice headlines, which we see a lot of. Woman was raped. Who raped her?
Yes,
right?
exactly.
Exactly.
Yeah.
Now, moving along, let's talk about what are some perhaps recent examples of local or even international that gender discourse can actually positively influence policy in particular.
I will turn to an international policy because I think that's a little bit easier. So recently in Nottingham, UK, in Nottingham, UK, catcalling and wolf whistling on the street can be reported as hate crime. So these are crimes that have been committed because the victim is a woman, right? And that's because they have begun to, challenge the boys will be boys discourse, as well as the women as sexual objects discourse. Unlike us, like the panel was talking about earlier, they were saying about how it's taken more than 20 years for us to actually have to table the sexual harassment bill. And part of the sexual harassment, what they wanted in the sexual harassment bill was for unwanted sexual attention like catcalling to be part of that bill. But it's been difficult in this country because we still believe that men can't control themselves and women's bodies are too sexual, and that will just cause men to act out.
Very true, very true. So we've seen a lot of these standardized stereotypes go across in media, but very quickly and briefly before we close the entire session, I felt something really important to touch on is how the lack of female representation in newsrooms, particularly in leadership roles, also leads to the type of stereotypical commentary and also news reports that are produced day in and day out. Any thoughts on this, Dr. Melissa?
So I think that news organizations, like any companies, right, capitalism is an ideology that guides a lot of companies these days. And workers are expected to work longer and longer hours because of the use of technology, tablets and laptops. People are expected to continue working from home, right? So we have this ideal male worker imagery or expectation. We expect women to be able to work like men without having any caregiving duties. And that could have caused some women to not be able to maybe get promoted as quickly within the media organizations, or perhaps had to leave the media organizations because of such expectations, which is seen across companies.
Very true indeed, absolutely true. Because when it comes down to the facts and the figures, I'll very quickly share this. Reuters Institute actually did a recent research which showed across 240 major online and offline news outlets, 12 different markets across 4 continents, only 22% of top editors were actually women. So now you also more deeply understand why it is that we continue to see variously patriarchal stereotypes perpetuated in media. Dr. Melissa, it's been an absolute pleasure. Thank you so much. I just wish we had a little bit more time, but as we come to the close of the session, your final parting thoughts on how we can build a more gender progressive Malaysian media landscape.
I think that the universities that are training young people to become journalists and editors, they definitely need to include more gender-sensitive training and gender awareness training in their curriculum.
Thank you. Thank you so much for that, Dr. Melissa. Now, of course, when we look at reviewing feminist research during the last 50 years, the prevalence of violence against women in media content, it becomes evident. It's actually become much worse rather than improved. And media that sexually objectifies women by portraying them in ways that emphasize only physical beauty, sexual readiness, as well as reducing them to decorative and sexual objects is harmful. The ball really is in media's court, ladies and gentlemen. Bodily autonomy, safety, security, and life cycle potential. Supporting these aspirations for more than half of Malaysia's population, women and girls, is the ethical responsibility of media in fulfilling our role as the fourth estate. It's been an eye-opening session once again. Thank you so much for the work put into it, Dr. Melissa. And on that note, I hand back to our MC, Ms. Zoe.
Thank you very much, Dr. Melissa, and also Ms. Tamina. That was a really an insightful session, especially regarding the media, because both Tamina and I work in the media, so we understand completely where Dr. Melissa is coming from. So again, ladies and gentlemen, we've come to the final plenary session for MWGF 2021. Now, time sure flies when the conversations are very, very interesting. So again, keep the conversation going in the comments section. Now, ladies and gentlemen, we shall move on to our final plenary session before revealing MWGF's 2021 resolution. Now, ladies and gentlemen, the third plenary session is titled Bodily Autonomy, the Youth and Social Narrative. Our moderator for this panel is Dr. Fatima Al-Atas, Senior Lecturer, Department of Sociology and Anthropology from Islamic International University, Malaysia. Dr. Fatima, over to you.
Thank you, Zoe. We're back today now. We're at the third session on bodily autonomy, the youth and social narrative. I'm very happy to be here with our speakers, a panel of speakers. We have Ms. Firzana Rizwan, founder of Monsters Among Us. We also have Kimberly Tan, over online, a committee member of Sarawak Women for Women's Society. And then we have Encik Hadi Azmi, freelance journalist, and Ms. Nadira Ilana, independent filmmaker and film programmer and writer. We're really excited to be here to unpack some of the really important questions and also to have a good conversations with our speakers, sharing their experience and also their thoughts and opinions on the issue of youth and the social narrative. I think I'll start first with introducing who our speakers are. Ms. Firzana is the founder of Monsters Among Us MAU, a youth-led NGO that upholds children's rights and combats child sexual abuse. So I've been following MAU's work for a long time, amazing work. Since 2020 August, she has been spearheading Lapor Predator project under MAU, a child-friendly reporting chat box for sexual crimes. She is also a media consultant at Arrow. She obtained her law degree at International Islamic University, Malaysia, and she is currently enrolled in a diploma in Sharia and practice at the University of Technology, Mara. So we're really looking forward to hear about the Lapor Predator program. Next, Ms. Kimberly Tan is a committee member of the Sarawak Women for Women Society, which advocates for women equality and the elimination of violence against women and children. She utilizes her bachelor's degree in psychology in her activism work, involving para-counseling and the campaign Bukan Salah Kami, and we'll be hearing about this as well later, advocating for the end of sexual violence, particularly for women in Sarawak. And we have Encik Hadi, our only male speaker today, so we'll be giving out valuable input as well for us. Is currently an independent journalist, photographer, and documentary maker, working with local, regional, and international news agencies. He combines his lifelong interest in photography and journalistic access to capture Malaysian socio-political narratives. Nadira Ilana is a Malaysian filmmaker and independent programmer from Kota Kinabalu, Sabah. Drawing inspiration from her Borneo heritage, she founded Telan Bulan Films with a focus on crafting contemporary indigenous and minority stories. She is currently on the board of advisors for the Sabah Creative Economy and Innovation Center, CINIC. And I know Nadira will be bringing in a lot of conversation about about intersectionality, so I think we will be having a good discussion here. Okay, before we begin, we'll call in our speakers to give their action statements. Firzana, you ready to begin?
Testing. All right, so a very good day, everyone. My name is Firzana, and as mentioned, I belong in a youth-led NGO called Monsters Among Us. So the single motivation that pushed us to establishing our reporting chatbot called Lapo Predator is because we learned that a lot of our Malaysians do not know how to make a report about sexual abuse, and even if they do want to make a report, it's always difficult for them to do so. And this roots from a spectrum of factors. There's lack of information about children's safety to children themselves. We don't talk to them enough. There's a high inaccessibility of justice for our minors, and perpetuation of victim blaming and fear of society's judgment. And these are the loopholes that we see on the ground when we work with our children. And thus far, Lapo Predator has accepted cases ranging from online sexual harassment and grooming to physical child sexual abuse. And we also observe that our children are increasingly utilizing the internet, but they are not taught on equipping themselves from dangerous activities online. And this is also because we don't remind them that, hey, you can say no to dangerous activities online. We don't emphasize enough to them that they are empowered to decide things for themselves, even on within the online sphere, for them to totally push away negative behavior or harmful behaviors online, because we don't remind them that they get to decide, that they do have a say in building a safer space for them to live in. So I think this is where our NGO comes in. We want to remind them that we are here to support children so that they are able to build their own self-autonomy and also their own sense of security for themselves. So that's where we are here. Thank you.
Thank you, Firzana. Can we have Kimberly next? Please introduce your action statement.
Hi everyone, thank you UNFPA Secretariats and the organizing team for inviting SWWS here today. Thank you Dr. Fatima and my fellow panelists, Fazana, Hadi, Nadira for your presence today for today's discussions. I am feeling the FOMO and my apologies for not being there physically. We have a very exciting event tomorrow, and that's our state election. So I will be fulfilling my civic duty. To begin, victim blaming attitudes marginalize survivors and make it harder to come forward and report abuse. If the survivor knows that you or society blames him or her for the abuse, she or he will not feel safe or comfortable coming forward. And in terms of raising awareness and ending victim blaming, Child Women for Women Society has provided para-counseling services over the last 36 years to survivors of sexual violence and sexual harassment, and reminding them that none of the harassment or their abuse is their fault when shame and stigma weighs on their already painful trauma. And we've also carried out programs with primary school students about child personal safety, about good touch, bad touch, and empowering them with the knowledge of their own body parts and saying no, they have the choice to decide for themselves what they want for their own bodies. We've also organized talks with secondary school students about healthy relationships and touching on boundaries and consent, which includes educating them about myths and facts of sexual harassment and sexual violence. During the COVID pandemic, when we were not able to go out physically and have talks with these students, we have compiled a training kit on healthy relationships. And the kit was produced to enable district officers to facilitate discussions on healthy relationships. It contains a video presentation in Bahasa Melayu and Bahasa Iban, which includes a specially written story, a student workbook, stickers, guidelines for the facilitators who are to engage young people to discuss issues openly, value themselves, help each other think through their choices, and have more knowledge to make their decisions. Also during the pandemic, we have promoted educational materials in terms of myths and facts to educate the wider public about social language of victim blaming that only perpetuates rape culture on our social media platforms. And over the years, our facilitators have heard how cases of rape are rather seen as a domestic issue than one that should be dealt with professional knowledge. So I believe that Bukan Salah Kami was born out of wanting to create safe spaces for women and girls to speak about their lived experiences of sexual violence and sexual harassment. So to elaborate further, Bukan Salah Kami means it is not my fault in Bahasa Sarawak, and it is inspired by the Me Too movement that has been localized for our community. And the term itself is a strong reminder to our survivors of sexual violence and sexual harassment that it is never their fault. For the campaign itself, it was crucial for us to address the issue to the public, identify the causes of sexual harassment and sexual violence, and ensure education from a young age, including changing social norms and promoting respectful behavior to each other. And only by discussing gender-based violence and its various forms of sexual violence, including sexual abuse, rape, sexual harassment, cyber grooming, blackmail, and stalking, will it decrease. And from my experience throughout the campaign that went on over for 4 months, survivors express how they are more willing to speak up or share about their lived experiences after reading stories from other survivors because they felt they are less alone. And we also see from this once that acts of sexual violence or sexual harassment are normalized in conversations, we are then able to discuss more openly about how to recognize and prevent sexual violence and sexual harassment against women and girls on different levels, whether it's at home, whether it's in schools, workplaces, or public spaces. Touching on the anti-sexual harassment bill, we were elated to see it tabled. And thank you to everyone for their hard work, everyone that was involved for over the last 20 years. However, as mentioned earlier in session 2, organizational obligations were left out. And this means that it does not require organizations to take further steps to prevent and address sexual harassment. Hopefully with time to come, preferably not too long of a wait, the bill will be amended so the lived experiences of our survivors are heard and respected.
Thank you, Kimberly. That's really powerful. Okay, next, can we have Jahadi to give us your action statement?
Hi, thank you. Bismillahirrahmanirrahim. So yeah, I'm a member of the media. I've written for mostly international press, and yeah, the world is changing rapidly. The old norms, the damaging ones that lead us to what we have here now is slowly being challenged, actively being challenged, and also actively being dismantled, thankfully. But unfortunately, I believe that the media itself is still struggling, still searching for how to, adapt to this new world. You know, when I studied journalism 15 years ago, there was this class called the new media. What was the new media back then is the media now. And throughout that 15 years, I think the media is still struggling to figure out how to adapt to these new realities. And, you know, for example, when it comes to reporting on cases, sexual crime cases, cases involving children, the media is in the middle of, you know, at one point they feel like maybe they have to compete with the social media. You know, in social media, people are throwing, you know, allegation teas being spilled left and right, and somehow the media somehow feel like, you know, do we compete with this? How do we compete with this? Because, you know, when you're in the media, you are restrained by a bunch of things. Because one thing, as Dr. Melissa explained in the previous session, media is a business. It's very regulated, heavily regulated, and there are certain laws that govern the media. For example, there's the Child Act. You know, you can't simply willy-nilly explain, you know, reveal information about children, and, you know, and this becomes a problem. No, not really a problem. There's a conflict when the audience, the readers, they feel like the media is not doing enough sometimes, because you see like, okay, the whole of Malaysian social media is talking about this particular scandal, this big case, but the media is not reporting it. Why is the media, you know, sidelining this very important topic? You know, but you know, the media is governed by all this regulation, all these rules. So it's not that the media is not paying attention, but the threshold for the media to report on this thing is much higher. There's much more stake. We have to check our facts. We have to vet. We cannot just go by one person's statement. We have to check and cross-check, and all that takes time. But I think, like, on the flip side, there's also media who appears to be quite unethical in how they report, disregarding all this regulation, despite it's being there. For example, you know, when there are cases that involves underage rape cases, you know, statutory rape, an older guy, you know, having sexual relation with a minor. Sometimes you see media reporting it as, the headline is, akibat cemburu lelaki serang kekasih. They use the word kekasih. When in actuality, that kekasih is a minor. So by using the term kekasih, lover, it diminishes the fact that it's a crime against children. So yeah, so there's this two thing going on. But for me, I think the media needs to get it up on all this, you know. There need to be an education within the media. It's not just for the incoming kids who are joining the media, it's also for the people who are already in the media, who are already established in the media, for the old people who are already in high places in the media to get re-educated on all these things, because unless that happens, you know, it's just gonna keep happening. Because, you know, sometimes the new kids coming in might be enlightened about this thing, but they are working in an environment where, you know, the boss was like, what nonsense are you talking about? Just report the story. So it goes nowhere. So yeah, education for everybody.
Thank you. There's a lot of things there to unpack and discuss later on. Nadira?
Hi everyone. Kapisanangan. Thank you for having me. Okay, so where do we begin? So I'm just going to be able to speak today so I'm a filmmaker from Sabah. So, I mean, we're talking today about like the Malaysian film media and mainstream industry, but the mainstream industry in Malaysia is essentially the Semenanjung Malay film industry. So I think I can sort of talk a little bit about my brush of experiences with that, but also more as an audience member. So I think I might begin by asking, like, why do a lot of Malaysians get turned off from Malaysian mainstream media? And I think that it's because it's not just about gender, it's also in terms of like race and how we kind of objectify one another. And so when we look at the Malaysian film and TV industry, it's actually separated according to, they say language, but essentially it's race, Malay, Indian, and Chinese content. And East Malaysians are only just now starting to be part of that national narrative. But when we watch these mainstream films that have been around for a while, I think that in terms of the representation of women, what becomes problematic is that you often see women as plot devices or rape culture, those kinds of things. Women only appear in these like gangster films, for example, as somebody to be murdered or somebody to be sexualized or somebody, to sort of like just further the plot of like the male main character. And so the question has arisen, like, how do you regulate something like that? Can something like that be regulated? And I think that by the time you get into that writer's room, it's already almost in a way a bit too late for perhaps this generation, but the next generation that is actually looking at inclusivity and diverse writers' rooms, those are the generations that need to be encouraged. But as a film, but from what I see as well in the Malaysian film scene and industry, and these are different things, because the scene is, we're talking about the community, and they might do jobs in the industry, but the community is where they tell personal stories that tend to be more socially driven, or it's more for society. I personally try not to have that division in my work, because I believe that whatever I do, even if it's commercial, it carries a heavy social responsibility. But like there are space, I believe that Malaysia has a lot of strong female storytellers and directors, and I'm quite proud to say that. I'm quite proud to say that about my country. And as a Sabahan as well, a lot of the strongest film directors that are coming out from Sabah now are all women, strong young female voices too. We may not have enough crew, and it is still very much a male-dominated space. But in terms of just like, I don't know if this is a solution that can be, that where we can fix it in the industry itself. But I generally believe that while it is extremely important to have female spaces for female told stories, I think that it's not a perfect solution, and it's not the only solution, because women are also, we also have our own internalized misogyny, and we are sometimes, because we consume the same, misogynistic type of media as well. But I also think that in the larger scale, as somebody who has experienced sexual harassment, death threats, stalkers, and and sexism in the industry, I think that a lot of we need to, at the home. I mean, if you're parents of children, for example, as well, I think that we need to teach our girls to take up space, and we need to teach our boys to get in touch with their own feelings, because when I find that a lot of violence against women, or violence or mental health issues to do with men, begin with boys not being comfortable with their emotions. And it's a really sad thing when men are physically stronger, but they fear their own emotions, which are created by their own bodies, and it creates this cycle of violence for everyone across the board, not just men and women, but other genders as well.
Thank you, Nadira. So I think we've heard the previous sessions, and we've gone through the whole day listening to different discussions on bodily autonomy. And what I really like about the action statements of our speakers is how they've highlighted certain issues about the changing times. And we haven't even talked about how the pandemic has affected gender-based violence and issues relating to body autonomy. And then we also have the big conversation about the different generations and the different age groups of the older generation and then the younger generation, and then that education also needs to happen at both levels. And then there's that conversation also about representation and how different groups of people are being represented, not just looking at genders, but also looking at ethnicity, looking at religion, and then we bring this conversation together. So I'm really looking forward to our discussion. My first question goes to Firzana. Working on children, how can we show up as a society to be more supportive to children's experiences, especially when they're the ones trying to report the wrongdoing? And then how can early education or early awareness about bodily autonomy reduce their vulnerability as children in facing all kinds of abuse, including child sexual abuse?
Thank you for that. I think it's important for us to start by acknowledging the fact that many of these cases of sexual assault and abuse involving children, they are prolonged and worsened due to the fact that children, at that point of time, were not aware that what was happening to them was in fact abuse. So that basically means we're not communicating enough with our children. We're not telling them what's right, what's wrong, what's safe and what's unsafe. But when it comes to supporting a child in reporting potential abuse or potential crime, I think as as adults surrounding children, we have to understand that reporting itself is such a huge responsibility, is such a huge luggage and weight to carry, right? So if we understand that, I think we'll be able to inculcate a more empathetical approach when we do support children who are in suspected abuse positions. Because many of us always go to the point where we say, if there's something really wrong, why don't you just report it? If it's something really happened, and if it's true that you are indeed a victim, why is it so hard for you to make a report? But people don't understand that the reporting part is just the start of a really long and exhausting and taxing journey, right? And that journey is never binary. It goes up, it goes down, and you can't expect a child to be okay with going to court, right? Going to court itself is scary. Even us reporting to the police about our missing IC can be intimidating. Now you expect a child to report about assault, about abuse, about violence. So I think having that in mind, understanding, looking at things from the survivor's point of view would help us supporting them better. Before we even go into the practical steps, we need to get the right lens to make sure that we are sensitive enough for our survivors, we are open and child-friendly enough for our children.
So, can you just enlighten us a little bit? What does that process look like? So maybe for those of us who are not aware of the kind of process, because there's one is the child speaking up to an adult to say, but that's not the reporting process, isn't it? That's just bagi tahu, or telling somebody that this happened to me. Can you just explain that a little bit more?
So because we do have children themselves coming to us reporting about their encounters of sexual violence, I think it takes us some moment to really just listen to them. It is a task to listen, right? Because normally when we hear something coming to us and we feel immediately like we need to save, right? Especially when it's a child, we automatically put on that savior cap on. Okay, I have to do something, I have to act now, I have to react now. Well, in reality, probably the first thing to do when it comes to supporting a child in cases of crisis is really sitting down, forcing yourself to breathe and listen, right? Because in many cases, you have an extreme extent of adults themselves dismissing the abuse, but you also have the other spectrum of adults where you immediately take actions without considering the position of the child, whether the child is ready or not to bring it to the authority, whether the child is ready or not to even tell this to someone else. And knowing the process of reporting is important. When you understand that going to the police is not the full stop, it's literally the opening of everything. You meet the officer at the counter. Once you proceed from there, you meet the investigating officer. Then you meet another person. And if it's an extreme case, you have to bring the child to see all of these random adults in a hospital, right? And are you knowledgeable enough of the process to inform the child that, okay, this is what you're going to go through, right? So that's why when it comes to bringing the child into the criminal justice system, you can't expect it to be like a one-day deal. You yourself need to equip yourself with enough information and support. And I think it's okay for adults to admit that we sometimes don't know what to do, because it is a very complex and bureaucratical system. Even people who have been practicing law have on the daily struggle with the system, right? So it's okay to admit that sometimes parents don't even know what to do, teachers don't even know what to do, but I think identifying the support that's around you would help you support the child better. Yeah.
Okay, the second question, how can early awareness and education help us reduce their vulnerability?
Okay, we always tell this to our audience. It's never too early to talk about personal safety, about your bodies with your children. It's never too early. Use daily activities to make them realize that your bodies are yours and that they are not mummies or daddies, right? Because I think the culture here in Malaysia is that if you're a child, if you're a minor, you're under my care, you're technically my property. So I think some practical ways for us to remind and empower our children by understanding that they have autonomy over themselves is really proving to them that they get to decide what they want about themselves. So if, for instance, if we are at a cold room, right, we don't ask them to put on the jacket, we ask them, do you think you want to use a jacket? We make them realize that, hey, I do have a say on what I actually feel. Or something that's probably more relatable to everyone, posting pictures and videos of children on social media, right? I think many of us are guilty of this, but do we take time to really ask them, are you comfortable with me posting your picture online? So if we remind them on the daily that, hey, even though I'm a child, even though I'm under the care of my parents, but I do have a say about what's comfortable and what's not, we make them connect with their instinct, we make them connect with their sense of self, then they'll be able to distinct what's good and what's bad for them. And I think that the absence of understanding what they actually feel and having to follow what adults say is one of the biggest factors as to why children sometimes are subjected to abuse. Because they're too normalized to invalidating their own feelings, while they're probably super uncomfortable, but because mom says I need to salam that uncle, then I have to. So reminding our children to connect to themselves and having that sense of self and safety, I think that's the best way for our children to have autonomy over themselves. Yeah.
That's a really good reminder that body autonomy is not just relating to, the bigger questions about sexual safety and things like that, but also about the very basic things, and learning that from childhood translates into adulthood. Okay, Kimberly, we're moving on to girls and women's experience now. Why is it so easy? Because you're doing work with Sarawak Women for Women Society on Bukan Salah Kami, right? Why is it so easy for women and girls' experience to be discounted? And what lies at the heart of this culture of victim blaming? And last question, the third question, so there are three questions here. Why is it easier to frame women and girls' questions as it's their fault for sexual abuse or for assault that happens to them?
Well, I think the overarching theme across this is the patriarchy that's embedded in our social language, first of all. From session 2, we have seen the presentations and the extensive work from WAO and AWAM that the numbers are pretty alarming when it comes to respondents of the surveys. They amplify and believe and probably practice the culture of victim blaming. And this is perpetuated through the use of misogynistic languages, the objectification of women's bodies, how women and girls are taught to behave in order to get a raise, or the quid pro quo exchanges for career or life advancements. There is also the glamorization of sexual violence, especially in social media or media itself, which ends up creating a society that disregards women and girls' rights and safety. Actually, Nadira shared last night that there's this Malaysian production that normalizes sexual abuse material, especially marital rape. And it is something that is aired on our national TV and celebrated by our local community, probably because we are somewhat proud of our local production. And unfortunately, when this issue is not being addressed, and until today, it is seen that many women believe that in a marriage, it is their duty to sexually pleasure their husbands. And we have to understand that what we watch, what our mind consumes from a young age becomes our practicing beliefs and values. And also the other reason people blame a victim is also to distance themselves from an unpleasant occurrence and thereby confirm their own invulnerability to the risk. So by labeling or accusing the victim, others can see that the victim is different from themselves. And people reassure themselves by thinking, "Ayo, I'm not like her lah, because I don't go to the bar, what? So things like that will never happen to me lah, you know." And I think that helps them feel that bad things such as like sexual harassment and sexual violence will not happen to them. And this helps them to continue feeling safe. And we need to inform and help people realize and understand that this is actually not a helpful reaction. And sometimes it also comes down to the reluctance of individuals to acknowledge that sometimes they too are able to cause harm with their words. Nisha mentioned earlier, why so defensive? Especially when you talk about men in power and they're put in their positions after a statement that they might have accidentally released that is not very gender sensitive, and they refuse to take the opportunity to be accountable upon their own actions. Yeah. I do want to add on though that I think not everyone who engages in victim blaming explicitly accuses someone of failing to prevent what happened to them. In fact, I think it's more understated forms. People may not always realize what they're doing. Something as simple as hearing about a crime and thinking you would have been more careful had you been in the victim's shoes is a mild form of victim blaming. I'm not excusing their behavior, but I believe in transformational justice because this journey with elimination of violence towards women and girls, it is a systemic one. And so we have to understand that I think we all believe that education really matters from a young age and from all levels, including different generations, different social statuses, different races, different genders. Yeah.
Thank you, Kim. I think that's really important when we talk about accountability. And I also want to touch just briefly on exclusive. Like, if we support our local industry, doesn't mean that if something's wrong and we criticize that and we highlight that we're not supporting our local industry anymore, or any kind of misogyny that happens in any industry, in acknowledging that and criticizing that. It's just about accountability. And the other one is how we're trying to do things. There's a lot of things, and many of these things are so internalized in us, whether it's individually or systemically, means that it will take some time. So we need to understand that even though we're trying to fix things, nobody's perfect, and we're moving towards getting better, and then we're in this together. And I think that's a really good way of looking at it. Okay. Thank you, Kim, again. Hadi, you've previously done some extensive work as a filmmaker in advertising houses. Can you share with us, maybe through some examples, how contents like this, especially digital contents or even billboards, would have an effect or an influence on the Malaysian audience on the idea or the belief of gender inequality or gender equality even?
Well, advertising, I was in advertising before I was a reporter. Advertising is perhaps an industry that is totally perpetuating stereotype. It lives and breathes by stereotype. It amplifies stereotype. So basically, whatever is presented by the decision making in advertising is always the idealized representation. So if you want to sell Milo, you find the idealized model of the best kind of person that you want to be associated with the brand. So I like to think of it this way, like Carl Sagan said, if you want to make an apple pie from scratch, you first have to invent the universe. So if you want to change advertising in Malaysia or in the world anyway, you have to change society, because advertising fits from society. What society feels is best, that is being taken by advertising, and it's a cycle. So advertising fits from it, and also it perpetuates this idealized view, and yeah, it can be very damaging for people. For example, until today, despite the makeup of Malaysian society, whenever there's a casting, there's always going to call the Pan-Asian looking people to to come and cast. If you don't fit that box, you are very unlikely to be called. And I'm sure Nadira can agree. For people in East Malaysia, who are not part of the mainstream, it's even more difficult to get represented. And it goes back to everything being a business, essentially, I suppose. For example, if you look at our most famous Malaysian ambassadors, Upin and Ipin, they have a caricature of everybody in Malaysian society. And I think because of their fame in Indonesia, they have a character, an Indonesian character now. But I'm not sure if they have anybody from Borneo in Upin and Ipin. So the Upin and Ipin in Malaysia, the Malaysia of Upin and Ipin is a Malaysia that promotes Indonesians but not our friends in East Malaysia. So yeah, that's the unfortunate thing about it. And yeah, I suppose for I guess I can mention it here also. While I was working at a production house earlier, when I was 18, I was in an unfortunate situation where I was in a casting room where we called people to cast for this drama that we're making. And one of the women that came for casting, we were in a room. It was me and a particular Malaysian actor, quite famous. So while the casting was going on, that lady unfortunately exposed herself to us, the two guys in the room, revealed part of herself. And we were quite surprised. We were caught off guard. Luckily for me, I was happy that my boss decided to put his hand on the lens, cut the take, and he talked to her, and then she explained that she had this assumption that this is how it is done. This is how you get a job. We're not sure who told her that, whether that was something somebody whispered to her based on their own experience, or was that based on a stereotype that came to her from her experience, knowing the industry. But yeah, it was quite a surprise, and it made me wonder whether, is this normal? Is this also happening elsewhere? Had it been somebody else, had it been another guy who was leading this session, would have this ended differently? So that was quite a awakening experience for myself. So yeah, I think there's a long way to go, a lot of things to be fixed, and yeah, I think it goes back to society. Yeah, like for example, I think the drama that Kimberly mentioned, I think we just should call it by its name. It's Ombak Rindu. It's a show that promotes, it romanticizes the relationship of a rapist and the woman that he raped. It's quite vile, but unfortunately for the Malaysian society, is heavily romanticized. It was taught as being sweet. Women in Malaysian media have this unfortunate trope of being there to save men. Most drama, if you watch drama in TVs, there's always going to be that trope of this rich heir of a big company that studies in London, then come back to Malaysia, is set to take over the dad's business, is wild, he is dating this girl who tak pakai tudung, and then suddenly he crossed paths with this gentle kampung girl who is very sopan, and that girl saved his life. So I think 80% of Malay dramas is like that.
Perpetuating gender inequality. Yeah. So there's two sides. One is what's happening behind the scenes for those within the industry, and then there are the consumers, with the public who are consuming, and then unfortunately learning or relearning about some of these issues. Nadira, how do you think representation is important? Yes, female representation and also the diversity of female representation is important in mainstream films and media. And then if you can give us some examples of internalized misogyny that you've seen in Malaysian or maybe even international media that shows this kind of scenes maybe or parts of it.
Okay, going on some of Hadi's points, great points by the way. I think maybe a place to start would be to talk about rape culture. And so because that seems to be the most prevalent device that people tend to use when it comes to women. Like, I get scared almost sometimes when I see a woman appear in Malaysian films, because I'm just like, okay, are they going to hit her? Are they going to rape her? Or are they going to kill her? The degree is almost to that point, you know. And I'm somebody who watches Malaysian films and is educated about it. I read this quote in the newspaper once where a woman talked about rape culture. Why is it so prevalent in Malaysian cinema? And she said that it's because Malaysians want to experience or the audiences here want to experience sex, but they are terrified of admitting that they want to have sex, or they are terrified of admitting that they have sexual desires, both with men and women. And so rape is a way to to be able to experience sex without, just admitting to ourselves what we want. And a lot of that has to do with, being part of a conservative society. And I do see it tied back into systemic racism, because when you have a patriarchal Ketuhanan Melayu government like this that is pushing this agenda to make people more religious, more conservative, more bigoted than the society actually is in order to get votes, then you see in the media, you don't see people who actually have the autonomy in film production to tell proper stories. What you're actually seeing are people who are a product of our society, of our system, of our authorities. And that's when it becomes very dangerous. More recently, the Minister of Communication, KKMM, Anwar Musa, he retracted this statement, or he tried to correct it later. But he did not take sexual harassment in the film industry very seriously, which is a major concern. And this came following the actor Fauzi Nawawi making rape jokes on a mainstream sort of like comedy platform. And what happened after that was that there was a small movement, there was a movement as well online that said, Rogol bukan lawak. And it's hard to talk about mainstream media without calling out Malay culture, because mainstream media is Peninsular and Malay-centric. So a lot of it has to do with us having to sort of analyze back what Malay culture is about. I'm a quarter Bugis, but I don't identify with it because it's a very different culture than what I was raised in. But you see, it becomes problematic in terms of when you're talking about representation, is just that our Malay women in this industry, are they empowered to say no when it comes to these gratuitous sex or rape scenes? I'd like to see more of that. I think that I'm hoping that it's going to come, but I don't see it just yet. Because the people who are advocating for this Rogol bukan lawak were also people who I'd seen, in those scenes where they said yes to being, to being violated. And it becomes problematic as well, because when we're talking about films like Ombak Rindu, there were female actresses who were defending the film, saying that, like, look, it's just a fictional film, it's not a documentary. I'm allowed to participate in a film where, a woman is raped by a handsome man because it's just fantasy, it's just fiction, without thinking about the larger social repercussions. And it's strange how some of these performers don't seem to understand their social responsibility, but then they can sell shampoo, knowing that people will buy them because of the influence that they have. So it's the same thing like that gets perpetuated over and over again. But also another, oh my God, I'm gonna get fried by the industry. No, but the other thing as well is just that I would like to see more Peninsular Malay women sort of stand up for minorities and other races, other women as well in the industry, to platform those stories. And I kind of have, it's too, there, it does exist, but I feel like the pool is still a bit too small. And this visibility really matters, especially to minorities and people who are less visible, because when they're not visible, that's when, their environment makes them like vulnerable. Because we had a little discussion last night with Kimberly, where we were talking about sort of like indigenous rural groups, how do we sort of shed light on these stories? Because for me, representation isn't just about going straight to the issue. Representation is also about building morale. So I don't think that necessarily you have to go to these groups and tell, stories that are about, violence against women, and, like within that context of sort of talking about the social issue to raise awareness. The other way to do it also, I think, is to, tell positive stories surrounding this community. And I think when you tell positive stories surrounding this community, about this culture, then usually I feel that it's the men first who start to become, their confidence starts to grow in a good way, in a healthy way. And when you have that, when you are able to sort of reduce that dejection amongst those certain groups or communities, you are able to create a healthier society in general, if that makes sense.
Yeah, I think you highlighted visibility, but also the diversity of the roles that women take, and the diversity of women taking those roles as well. So I think that's really important, and also the impacts of that. I have a question for Farzana. I want to talk about the current mechanisms that we have at schools and education institutions in terms of, eliminating or stopping child grooming. So what do you think about these issues, or what should we do next?
I believe we can start by identifying what's lacking. I think many of our personnel who are in the education system may not know the true or the deep, complex meaning of what grooming is. When they see a relationship happening, they say it's a fantasy. It's it's just play things by our children. They don't see the psychological and manipulation aspect of grooming. They don't see that a child who is seen to be in love in a particular relationship is actually, a manifestation of the abuse. So understanding and building capacities of individuals who are working with our children to understand the legal definition of what sexual grooming is. But when we talk about mechanisms, I think one thing that our national education system is lacking is the very weak child protection policies that are either non-existent, or even if there is, it's probably not enforced. So what I mean by having a child protection policy is whether an organization or a particular industry or sector or company upholds the protection of children. So are your staff trained to handle cases of sexual assault or harassment? Is your recruitment process going through the process that would disallow all of these predators to be close to our children? I think that's where we are lacking. And I think having that system in place will be able to prevent so many unwanted events, right? And a part of having a policy or a structure itself when it comes to child protection is also building the sensitivity with the teachers and also the staff in schools. If they don't understand these topics of violence, if they don't understand abuse, if they don't understand bodily autonomy, then all of these things will not be able to convey to our children, and they don't have the language that they need to protect themselves. So I think that's where we are lacking, and how we can address it is by building capacities of our education system itself to be able to work with children healthily and safely.
Thank you, Fir. Okay, we're just rounding out now. Fir gave a good rounding statement about building capacity. For you, Hadi, what do you think is needed? If there's like one policy that we can introduce or uphold for the media and advertising in terms of upholding bodily autonomy, what would that be?
I would like to go back to what I said at the start, which is to get everybody educated, to get everybody trained, to train and to retrain, and to train people to unlearn the things that they are doing, and to make them, learn the right way of doing things. So yeah, that is very important, I suppose, because unless we have that, whatever, it cannot be a legislation, it cannot be something that comes in the form of a fine, it cannot be something that is forced onto people. It should come from understanding. People need to understand why the things that I did before is wrong and why I need to do it this way. So unless people realize that and internalize that in themselves, nothing substantial is going to happen.
It needs to be something more organic. Yeah. Okay, Nadira, what about you? What do you think is the one thing that you want to sort of highlight in terms of the change that we can do to uphold bodily autonomy?
There's not really one solution, because it's just so encompassing. We're talking about storytelling, and storytelling is just fitted in within all aspects of our lives, really. But where do I begin? I like what Hadi was talking, that was just like, if you want to make an apple pie from scratch, you have to create the universe. Because I think that as a film director, I'm in the business of creating universes, because we're adding all our biases, all our experiences, everything into into the stories that we tell. So I think it's really important that when people study film, whether it's in film school or not, when people study film, that they understand it's more than just the relationship between the camera and your set. It's actually about people, about humanity, about how we treat one another. And so that's why I insist that when I'm directing my sets or when I'm producing, that we emphasize on compassion in front of and behind camera. And so, but the other thing as well, when we're talking about intersectionality, I think that the industry needs to encourage more female crew, not just female directors and storytellers. We need to have more female crew as well, because there are many different ways that women can contribute to the lens of how we tell these stories. But I would also like to encourage Peninsula Malay women to also consider sharing their platforms with people of other backgrounds and other genders as well, because Malay women can't do it alone either. And if they really want to advocate for women's issues, they need to expand beyond what is the existing mainstream, because I think that a lot of them are too comfortable at this stage to be able to speak for the whole of Malaysia. Malays can't speak for the whole of Malaysia. Malaysians can speak for Malaysia.
It's giving platform to everyone, not to speak for others. I think that's a good something that we can bring back. Kimberly, would you like to give us your final statement?
I think I would like to bring back on what we have lacked in the entire sexual harassment bill, and that's organizational obligation to creating policies at work and comprehensive training, especially given to our frontliners. We're speaking about health professionals, police officers, educators, and staff in government agencies. Well, I understand that there are some form of training provided at most levels. However, the training that I'm referring to here is the one that's more survivor-centric, and it is more important to have frontliners that are more compassionate towards survivors and are more tactful in how they converse with survivors. Sumitra shared in session 2 that there is a disconnect with knowledge and practice. And there's this subculture that educates girls from a young age that they should not move around too much during phys ed class or else they will tempt the boys, and nafsu lelaki tidak boleh dikawal. And so these individuals become frontliners of our community and our future generation. And this is what they learn from a young age. And this is instilled in them that they do not have bodily autonomy of themselves, and they have to watch what they're doing all the time, or else it perpetuates violence towards them. Yeah.
Thank you.
So
Thank you very much. I think some of the conversations that we've been having today are sometimes very difficult for us to sort of sit and just listen. And I think that takes back to what Fir said, even for children, listening to them, we just need to sit down and listen and have these conversations with the different groups of us and create spaces for these conversations to happen and to hold those spaces, especially if we have the capacity to hold those spaces and to allow others to speak. So we may listen, and then a lot of these things take a lot of time for us to unpack and relearn and educate, not just to be placed on youth alone, to understand what bodily autonomy is, and then to change the world for the next generation. But it's a comprehensive kind of setting with different people having different responsibilities to learn about what bodily autonomy is and to make that change specific to where they are within the society. I think that wraps up our session today. Thank you so much to our speakers and to UNFPA.
Thank you, everyone.
Well, thank you very much, Dr. Fatima and Palace, for those refreshing perspective on youth voices and media narrative when it comes to bodily autonomy. Now, ladies and gentlemen, don't go anywhere. We'll be right back with the MWGF 2021 resolutions.
Ladies and gentlemen, it's 2021. We've all collectively survived 2 years of a global pandemic. And equally importantly, considering the pandemic's deeply disproportionate impacts on women and girls, from the unpaid care burden, high rates of female unemployment, to domestic violence, period poverty, increases in child marriage, and online gender-based violence. Today, the legal definitions of violence against women and girls entails a holistic perspective which recognizes both types, physical, sexual, psychological, economic, and femicide, and modalities, institutional, community, work, school, of violence against women and girls. Most recently, the UN Sustainable Development Goal 5, Target 5.2, calls to eliminate all forms of violence against all women and girls in the public and private spheres. All forms of violence against women and girls are a violation of women and girls' bodily autonomy. And thus, keeping with the theme of this year's Malaysia Women and Girls Forum, Bodily Autonomy, ensuring rights and choices for Malaysia women and girls, it is now my immense honor to present the resolutions of MWGF 2021. Resolution 1. Align government programs and strategies in line with SDG 5 on gender equality by 2030. Resolution 2. Ensure the successful rollout of the Anti-Sexual Harassment Bill, followed by the drafting and tabling of a Gender Equality Bill and other laws to ensure bodily autonomy and integrity. Resolution 3. Adopt a whole-of-society approach in normalizing and upholding bodily autonomy and integrity, including more institutional pushback against rape culture. Resolution 4. Strengthen and normalize comprehensive sexuality education, CSE, in schools to better equip girls with knowledge of their rights to bodily autonomy. Resolution 5. Create targeted economic recovery efforts aimed at strengthening the position and involvement of women and girls in society, including policy making and political participation. And finally, Resolution 6. Engage with and uplift the media to practice ethical journalism that disrupts the status quo and offers societal counter-discourses. And with that, we conclude the 6 resolutions of MWGF 2021. I hand the floor back now to the MC, Ms. Zui.
Thank you, Ms. Tiwina. That was a necessary list of resolutions promoting women and girls' bodily autonomy, and definitely lots for Malaysia to strive towards in 2022. Now, what's clear from each one of today's discussion is this. For harmful stereotypes to change, there must be a shift in both personal expectations, attitude and behavior, and wider societal rules, laws, and practices. Now, ladies and gentlemen, as we draw to the close of the second Malaysia Women and Girls Forum, we've heard thought-provoking and actionable solutions for some of the continuing impacts the COVID-19 pandemic has had on vulnerable women and girls. Now, ladies and gentlemen, these are the resolutions we have collectively reached, and this is the roadmap for both women and girls' bodily autonomy from childhood all across the lifespan. Now let's all commit to using our voices, our platforms, and our representation to further the cause of bodily autonomy and ensuring rights and choices for Malaysia's women and girls in 2022. With that, ladies and gentlemen, on behalf of the United Nations and UNFPA Malaysia, we thank you for your invaluable participation and support. Now, my name is Zoe Teo, and it's been a pleasure to have been your host for today. Now, we look forward to welcoming you again for our next year's MWGF. So take care and stay safe.